and respected and honorable doctors who have accepted the invitation and have come here on this Australian Malayali Islamic Association platform. First of all, let me thank the New South Wales Health and the doctors who are in the forefront in our race, the race of the humanity against this deadly virus. And we thank you on behalf of the community. I thank you on behalf of Australian Malayali Islamic Association, who are doing a lot of work, standing in the front against deadly virus. So in this current situation, this is very relevant, and I thank you once again. Now, just a briefing about the AMIA. Australian Malayali Islamic Association was formed in 2011. And at the time it was formed by a group of brothers who wanted to instill in the growing children here who are brought up, either migrated or growing up here, to follow the path of the study authentically the religion Islam, and also through Quran and through the teachings of Rasulullah sallallahu alaihi wasallam. So that was the reason why this association was formed in the first place in 2011. And from then on, this association has grown up and to a very big extent where it has become a platform. And this is an example where we are honored to have this session today, where we can convey as much as information to the community, and whatever the community needs, they come to AMIA, and it's a platform for back and forth information transfer. And we do all the activities for the betterment of our community and for our kids who are growing up here, and also for the new families who are migrated here and hence will be also coming here in the future. So AMIA's activities, I'll provide in a nutshell. If I keep on talking, it will go on like that. So in a nutshell, AMIA has got monthly Islamic classes every month, and it has got a family gathering day every month. So normally the Quran classes are happening towards the fourth Saturday of every month. And then in addition to the Quran classes and the monthly gatherings, we have got Kids Fest, which is an all-day event where we have on the field as well as indoor kids competitions, and giving away about 80 to 100 certificates and medals to our kids in the community. And in that Kids Annual Fest, we have got other associations also being part of our AMIA Kids Fest Day. Then along with that, we celebrate Eids, the 2 Eids, and also we have got separate day for the ladies activities, ladies functions. And upon all that, we have got workshops, teens workshops for both kids and teenage boys and girls. Now, AMIA has got 2 educational wings, which is one is the madrasa and also a community language school, which is a Malayalam school. And the classes for those Ilm is our madrasa, and also community school, which is for the Malayalam language, which is called Pallikudam. This happens on Sundays. And that's a 2-hour classes we have got for each. And AMIA has also got a charity wing, which we support the needy both locally as well as overseas. So most of our overseas support goes to India and our Muslim countries. And we also have Janaza plots for our community, which is the investment of our community for the benefit of the Muslims here in Australia, in Sydney. So that's a brief about our association and its functions. And these activities, as I've mentioned, these normally happen when we have face-to-face sessions. But because of the COVID in the last year and this year, we mainly have our Quran classes and our monthly talks, both local and with the international speakers and local speakers. So that's a brief about AMIA and its functions. I once again welcome the doctors and thank you very much from the bottom of our hearts for being in this panel and giving such a wonderful information about the COVID, its effects and the vaccines to our community. Thank you and welcome to this evening session. Thank you very much, brothers and sisters.
Jazakallah khair, Ashim, for that wonderful talk. May I invite now Dr. Faisal Kakat, a senior member of AMIA community, as well as one of the founder of this association, to welcome address and to declare this session as an open for the community. Faisal Kakkad. Faisal?
Assalamu alaikum.
I think people in that room, they have to mute themselves.
They're fun.
Thank you. Welcome to all participants and speakers. On behalf of AMIA NSW, AMIA NSW is organizing a session on the COVID and the vaccinations. And as you know, the world is suffering from COVID all over the world, and it affects our both physically and economically. So we don't have a treatment for we don't have a cure for the COVID, but fortunately we have got vaccines. Within this short time, we developed a vaccine and it is working. Unfortunately, some people are behind vaccine. That means it is not speedy. It may be due to laziness, and the other small amount of people or small proportion of people, they are against vaccination due to lack of knowledge. So I hope this session will clear some lack of knowledge and answer the questions. And you can ask any questions to the panel. And I welcome you to this wonderful evening. I welcome the speakers, Dr. Aflah Roohullah, oncologist, and ID physician Mohammed Assoum, and respiratory physician Dr. Ali Parappil, cardiologist Dr. Imran Kassam, nephrologist Sheikh Qaidar, pediatrician Dr. Habib Bhurawala, and another pediatrician Dr. Junaid Sheikh, and pediatrician Dr. Lenina Chennari, and general practitioner Siraj Hameed, and general practitioner trainee Dr. Faisal Kakkad. All of you are welcome to the session, and I hope there will be many questions. And if you need to ask any questions, please send us a Google document or just raise the hands, and Dr. Shahir will manage the question answer session. Thank you. Welcome for one more time to the participants and the speakers. Thank you.
Thank you, Faisal. Very kind of you. Let me now introduce or welcome Dr. Faisal Kakkad. Faisal, whom we call as Genu, is our second generation AMIA community. So she's very close to us. Alhamdulillah, she's doing a medical profession. Currently, she's a SRMO, Senior Resident Medical Officer at RPA. And currently, she's doing a term in which she's managing as one of the member in managing COVID cases at home. So I think there's no better person than her to anchor this session from here. She's a young doctor and she has a lot of achievements in this small time, and may Allah reward more and more as she grows. So may I invite Faisal to anchor the session from now. And we have Sheikh Qaidar will be moderating the Q&A. So inshallah, from now, it will be Faisal and Sheikh will be managing the show. So let's go to the today's agenda, inshallah. Jazakallah khair once again. So Faisal, please take over the session from here. Thank you.
Dr. Ali, thank you for the very kind words and lovely introduction. I'll just try and share my screen. Is the share screen visible?
Yep.
Okay, so welcome everyone again to the COVID-19 Community Awareness Session held by AMIA. So I will be starting by introducing the speakers. We have an expert panel of speakers who are all experts in their own fields and will be giving us an insight into their relevant topics. Just a reminder that this session is meant to be interactive and beneficial for the community. So if you do have any questions, please think of them and please do type in the chat box or on the Google Docs that has been available. So to introduce the first speaker, I have. Okay, so our first speaker for the day is Dr. Aflah Roohullah. Dr. Aflah is a medical oncologist and the head of department at Liverpool Hospital. He's also a phase 1 trial specialist with expertise in clinical research. Dr. Aflah is also a senior lecturer at Western Sydney University. He will be giving us a brief about COVID and, more importantly, the Islamic perspective of a pandemic.
Jazakallahu khair. Bismillahir Rahmanir Rahim. Innal hamdalillah nahmaduhu wa nasta'inuhu wa nastaghfiruh wa na'udhu billahi min shururi anfusina wa min sayyiati a'malina. Man yahdihillahu fala mudilla lahu wa man yudlil fala hadiya lahu. Wa ashhadu an la ilaha illallah wahdahu la sharika lahu. Wa ashhadu anna Muhammadan 'abduhu wa rasuluh sallallahu alayhi wa sallam. I'm just going to see if I can change to a gallery view, which makes it easier to actually see people.
Yeah.
Jazakumullah khair for inviting me to this group. And I guess my specialty really has very little to do with coronavirus. But I've been invited to give a perspective on what Islam has to say about coronavirus. There has been a lot of research done on Islamic ethics, and they're based on the principles that we find within the Quran and the Hadith. And I wanted to just select some particular snippets to discuss today, given that I only have 10 minutes. Allah subhanahu wa ta'ala says in Surah Al-Anbiya, وَمَا أَرْسَلْنَا قَبْلَكَ إِلَّا رِجَالًا نُوحِي إِلَيْهِمْ فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ. Allah subhanahu wa ta'ala says that we sent before you men that we gave revelation to. And so ask those who have dhikr, who have knowledge, if you do not know. The Quraysh, as you know, were the people, the contextual background in which the Quran was revealed in. And one of their statements as disbelievers was, how is it possible that Allah subhanahu wa ta'ala has sent a human being and has given him revelation? Shouldn't it be that if Allah gives revelation, that he should in fact send down angels? And so Allah subhanahu wa ta'ala says that we sent before you human beings and we gave them revelation. So ask those who know, Ahl al-Dhikri, and the dhikr at the very basic level means remembrance. And it denotes those people who study and memorize and know. So it is you can say, a surrogate for knowledge. Who are the people of knowledge at that time? Where they were actually the Yahud and the Nasara, who were given the Tawrat and the Injil, and within their books and in their knowledge was that prophets came before, and those prophets came in the form of human beings. So Allah subhanahu wa ta'ala is pointing out to them that as the specialists in this field of who has received a revelation before you, and that is in fact human beings have received revelation. So the reality of what is happening with coronavirus is that everyone has suddenly become an expert in vaccines. everyone has suddenly become an expert in their own health. And in all other matters, you would go and seek an expert in a field. If I'm a cancer specialist, that I treat, for example, gastrointestinal cancers. If someone were to come to me and ask, well, I've actually got thyroid cancer, what should you do? I would say to them, well, you know what? My colleague treats thyroid cancers. Go to them because they're a specialist of that field. I remember training as an intern, and my first rotation was orthopedics. And there was one orthopedic surgeon that was a hand specialist. One was entirely just a foot specialist. One was just a hip specialist. And the hip specialist only did hips. He didn't treat the feet. And so if you want to understand vaccines, you go to a vaccine expert. If you want to know how to manage coronavirus and the management of the lung, you go to a respiratory physician. And you liaise with an epidemiologist or perhaps a infectious diseases specialist. This notion that I, as a Muslim, know everything, and my Sheikh said this, or my friend said this, or Google or YouTube said this, and that is my source of knowledge, is actually against the principles of Islam. There is a hadith that is narrated by Abu Dawood, where the Prophet ﷺ says that if a doctor treats a patient and he treats something that he does not have knowledge about, and that patient gets a harm from the treatment, then the doctor is liable for that. And within that simple hadith, you find the basis that patients can actually sue a doctor if he practices in something that is not his field. In the same way, I will not be a person to say that, you know, I know everything about the Pfizer vaccine and you should have this. I'm not a specialist in vaccines. What I know about, I can talk about, but what I don't know about enough of is not my position to start commenting about. The second ayah that I wanted to cover today, and 10 minutes isn't enough to discuss Islamic ethics. The second ayah I wanted to cover today is Allah subhanahu wa ta'ala says in Surah Al-Hujurat, Ya ayyuha alladhina amanu, in ja'akum fasiqun binaba'in fatabayyanu. And in the qira'ah of Hamza and Al-Kisa'i, it is fatathabbatu. Meaning that, O you who believe, if someone of Ahl al-Fisq, someone who is a sinner, someone who is an habitual of making lies or wrongdoing, comes to you with a news, then make it clear, find out what the reality is. A related hadith to what I'm trying to make the point about is that the Prophet ﷺ said that it is sufficient for a person to be called a liar that he passes on everything that he hears. And in the world today, one of the specific societal problems is social media. And the problem with social media is that it is exceedingly easy to, at the click of a button, send a video to 200 people, 1,000 people, 2,000 people. And you have no knowledge of what you are sending. The Prophet ﷺ said that if a person lies about me, and he makes up a lying hadith, then he should get his place ready in the hellfire. So a person just passing on a message without really taking into consideration what it means is against the principles of Islam. So this habit of forwarding videos and forwarding messages that you have no knowledge about may confuse someone else and actually results in you being written down as a liar in the book of Allah subhanahu wa ta'ala. The very final things, inshallah, in 1 minute that I have, I want to say is that The qadar is written in the hands of Allah subhanahu wa ta'ala. But the Prophet ﷺ was asked once about medicines, and he said that Allah subhanahu wa ta'ala has created the disease and he has also created the cure for it. And if the medicine works, then that is the qadar of Allah subhanahu wa ta'ala. On the other side of the coin, the Prophet ﷺ said that a person who dies in a ta'un, then he is a shaheed. So some of us have lost relatives. Some of us have lost many relatives. When the pandemic was happening in India, my father's side comes from India, and my paternal uncle was calling him on a daily basis to say that so-and-so has died, so-and-so has died, so-and-so has died. So the position of the Muslim is that when people die in a pandemic, then that person is written as a shaheed, and inshallah his sins are forgiven. So this gives the heart ease when you have to sit down at home in lockdown and you are in difficulty and people are sick and dying and having hardship, then Allah subhanahu wa ta'ala gives ease for that as well. I thank you for inviting me. Very brief statements that I could give in 10 minutes. And inshallah, happy to answer any questions in the question section. Jazakumullahu khair.
Jazakallah khair, Dr. Aflah Roohullah. That was very insightful, particularly hearing of the Islamic perspective, especially given the misinformation that is around in today's age in regards to COVID and how we can find the spiritual strength from our own religion. All right. So moving on to the next speaker. I hope the screen is visible again.
Yes.
Thank you. Okay. So our next speaker is Dr. Mohammed Assoum, who is an infectious disease epidemiologist and global health specialist. His background in public health and infectious disease epidemiology has actually enabled him to do quite significant things. So he's helped, along with his teams, to treat over 1 billion people across 25 different countries. He has worked with the prestigious World Health Organization and been part of many different initiatives. He's also the founder of Mercy Global Health, which is leading the Australian health communications on COVID-19 and vaccinations through a pro bono initiative. They're aimed at preventing the spread of misinformation and protecting communities from such influences, something that is really relevant to today's topic. Dr. Assoum is also a research fellow at the University of Queensland, where he is leading research into COVID-19. Please welcome him to give us a brief of COVID and its variants.
Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you very much for having me on your platform. It's an honor to be here and to speak to all of you. So I'll start off really briefly just by introducing COVID. I know everyone probably knows what COVID is, but just to contextualize a little bit, then I'll dive in a little bit more into the variant itself. So in terms of COVID, it is a coronavirus. So it's from the family of coronaviruses, and they're known as coronaviruses because they've got little spikes on the surface of the cell, the viral cell, that look like crowns, and that's why they call it coronaviruses. So COVID-19 or SARS-CoV-2 is the newest coronavirus in the family, and it was first reported in December 2019. So that's why it's called COVID-19. So in terms of its similarity to other coronaviruses that we may have seen, we've come across a couple in the past. And so the first one that we remember, at least in modern memory, is the SARS virus that came out in 2002. And then, it has an 80% similarity. So COVID has an 80% similarity to SARS. And the other one is MERS, which came out in 2011. And it has a 50% similarity to MERS itself. So because COVID-19 is an RNA virus, so it's slightly different to other viruses, it means it's highly unstable and it mutates quite easily. And because it mutates quite readily and easily, especially with more transmission, it means it could actually be quite potentially dangerous. So looking at the variants, we've all heard of all these different variants, and let me just provide you some context to those variants. So the variants are basically the mutations of the original strain. And at the moment, we have quite a few different variants, but the ones that you mainly hear about are the alpha, beta, gamma, delta, kappa, and lambda. So in terms of these variants, the way they're labeled are based off where the original mutation of the original strain originated from. So say, for example, the alpha strain, that is the mutation of the original strain detected in the UK. So that's why we call it the alpha strain. The beta strain is the mutation that we saw from the original strain in South Africa. The gamma strain is the mutation from Brazil. The kappa strain is the mutation from India. And the delta strain is a mutation of a mutation. So it's most widely believed to be the mutation of the kappa strain, or potentially the alpha strain. So we're still trying to map out the origins of that strain. So yeah, the delta strain is a third generation virus, basically, because it's a mutation of a mutation. And then you also have the lambda strain, which is from Peru. So what we need to know about these different strains is that each strain has slightly different properties. So some strains are a lot more infectious than other strains, and some strains provide some form of resistance to treatments, to I pronounce the word, but to some treatments of COVID. And that's where we get into this very tricky situation of how do we deal with so many different variants. So to give you an example of the delta strain, because we all hear delta, delta, delta. So the delta strain, with the person with the delta strain, they produce 1,600 times more viral particles in their respiratory system and in their nasal passage and breath than they do with the original strain, which means that the delta virus, and through the delta strain, you are significantly more contagious because just with the sheer number of extra particles that you're exposing to people. And so when we compare this to the to the reproductive index, what we call the reproductive index, it's what we call R0, which means how infectious is the virus really? So how many people can you potentially infect per exposure event? So for example, the original Wuhan strain had an R0 of 2.5, meaning per exposure event, you're likely to infect around 2.5 people. And then these 2.5 people would infect another 2.5 people and so on. And when we compare that to the alpha strain, the UK strain, that went up to 3.75. So there was quite a bit of a jump in terms of how many people can be infected and transmit the virus. However, with the Delta strain, we are up to an R0 of 5, with some places going way above 5, but the average at the moment is an R0 of 5. So what does this mean? It means that the Delta strain at the moment is as infectious as Ebola, so it has the same R0 as Ebola. It's more infectious than smallpox and twice as infectious as the Spanish flu, which killed 50 million people between 1918 and 1920. So it also means that if we were to, so with this R0 of 5, what that also means is if we have 10 cycles of infection, so one person infects 5, these 5 infect another 5, and these other 5 infect another 5 each. After 10 rounds of infection, we have one case turned to over 10 million cases. So that's how infectious the Delta strain is. When we compare this to other strains, some other strains have much less reproductive ratio, and others are, well, none are as infectious as Delta at the moment, but we are keeping a close eye on Lambda from Peru, which is slowly creeping up numbers. At this point in time, the Delta variant makes up around 95% of global infections in terms of strains, with the other 2.5 and the other 5% being the Lambda, the Alpha, and the Gamma strains. So the other strains are still there, but we see them in much smaller numbers as the Delta strain surges through. You heard me say that there were some other variants that are of interest. The other variants are Eta and Iota, which are, again, they're much smaller in concentration, and they both originated, one originated in Nigeria and the UK, and one originated in the US. So Eta originated in Nigeria and the UK, and Iota originated in New York. So the problem with these ones is that there are some experimental treatments that have been used for people suffering severe COVID and preventing severe COVID, and these are monoclonal antibody treatments. And there's also convalescent plasma transplants that they're doing in the US. And if you have the Eta and Iota, these strains are resistant to that, and you have low susceptibility of these treatments actually working, or low likelihood of these treatments working. So those are just a quick introduction to the strains and the variants. And the thing that we are most concerned about, and the reason why you find us being so aggressive with, we find the medical world being so aggressive with this vaccination, with vaccinating now and ensuring that we bring the prevalence down, is because our biggest fear is these mutations mutate into 4th and 5th generation viruses, which are resistant to vaccines. So currently our vaccines are our only line of defense. And if all else fails, then we have to go back to the drawing block and redevelop the vaccines for new strains, which also sets us back. So that is why you find that there's a big push for the vaccines now, because the vaccines we have now are effective against all the current strains we have. There's slightly varying degrees of effectiveness across different strains, but nonetheless still effective at, for the most part, in preventing the disease, but also most significantly reducing the risk of severe cases, hospitalization, ICU, and death from the different variants. So that's why you find there is a big push for vaccines, because if we allow this virus to continue spreading, the risk of mutation is significant. And I think that's all for me now. Thank you very much.
Thank you, Dr. Assoum, for giving us insight into the variants. I certainly didn't know that Eta variant was one of them, so it's definitely given us a lot more context. All right, now moving on. So again, just a reminder to everyone, please do post your questions in the chat box or alternatively in the Google Docs. So our next speaker is someone we are all very familiar with. It's Dr. Ali Parappil. Dr. Ali is a respiratory and sleep physician. His research interests include chronic obstructive pulmonary disease, asthma, obstructive sleep apnea, and lung cancer. Dr. Ali, as we all know, is very highly actively engaged in our community. He has led many community events, including blood donation campaigns, helping out with the children's madrasa, and also other charity events. And he's always a familiar face to everyone in our community. He's also served as the AMIA president and is the current vice president as well. So please welcome Dr. Parappil to give us a briefing about COVID and the lung.
Jazakallah khair, Juno, for your kind words. Let me take some time to share my screen. sorry. Assalamu alaikum warahmatullahi wabarakatuh. Jazakallah khair for that term click. I'll be speaking to you about COVID and the lung symptoms and the lung-related complication as well. I'll be briefly touching to you. Okay. The COVID symptoms are mostly respiratory, could be upper respiratory tract or a lower respiratory, which I mean, it can have a cough, flu-like symptoms, and shortness of breath. The studies have shown that 30% of the patients are asymptomatic. Then it has got a wide spectrum of symptom variation. It can be mild disease, that means cough or fever, myalgia. Could be mild disease. They don't have the symptom of pneumonia at that stage. But in severe diseases, they become more dyspneic or shortness of breath. And many times they become, low oxygen saturation. That's one of the indication when the patient has to be admitted. The lung is the common organ involved, or because we all breathe in the air that contains the virus particle. So when the virus particle reaches the lung, it binds with the lung a receptor called ACE2 receptor, and they go into the lung, and then they multiply, and the symptoms are produced. Now, people who become critically ill, they become respiratory failure. That means we all breathe in oxygen and expire out carbon dioxide. It comes to a stage where we are not in a position to breathe in enough oxygen and to expire enough carbon dioxide, and that makes us critically ill. And that kind of patients need assistance in ventilating, either oxygen. If not, then they need to be ventilated and admitted to ICU for further assistance. As it progresses, this patient can have a multi-organ failure, which I'll touch basically up later. Now, what are the risk factors to get a severe illness? Of course, as you grow elderly, or the age is a big factor, because we all know that as we grow, we get all the other immune system down, and we will have many other disease, diabetic, and so they are increasing age, a big risk factor in. Also, the other comorbidities, that means other illness such as cardiac disease, diabetes mellitus, COPD, in later smoking, any other another lung disease, moderate uncontrolled asthma, cancer, especially the lung cancer, and any metastatic, it means cancer from other part spreading to other organs, kidney disease, and any other transplant, like such as hematopoietic or renal transplant or cell transplant. All this patient has got reduced immunity compared to others, and obesity and definitely smoking is also a risk factor for having a severe illness. Now, regarding clinical manifestation, the incubation period is an average is 14 days. It can range from 5 to 7 days. And initial presentation from a data of a study conducted of 370,000 people shows cough is the predominant symptom what they have, and followed by fever, myalgia, headache, short of breath, minimum sore throat, diarrhea. And the unusual symptom what we come across this virus is loss of taste and smell, and sometimes they also have gastrointestinal symptoms. Now, coming back to the respiratory, as I said, it could be a minimal cough, and this patient can be managed at home with mild fever, as what our Anchor Juno is doing now. What we are worried is that when the patient becomes short of breath, that's the time, and the oxygen goes down, then we are worried. And that time, the patient is admitted to hospital, and they closely monitor. From there, if it progresses, then they've got a pneumonic-like features, and they can go for a stiff lung, or ARDS, called as acute respiratory distress syndrome. And they can also have a cardiac related complication. I'm not touching on that. Dr. Imran is going to talk more about that. Now, they do have a complication called as thromboembolic complication. That means this could be a blood clot, can be in both, the arterial system, which pump the pure blood, and the venous system, which drain the impure blood to the heart. And that's a very major complication. Not a major, but we have seen it as in few patients in COVID per se, as also related to vaccination, which I'll touch it basically. So neurologic complication, mainly delirium and encephalopathy, and you've got an inflammatory complication, just as it shows as it's a pre-inflammatory condition. So definitely it has to have some markers. So that markers which you can measure, they are D-dimer and serum ferritin, and also we have seen few reports of a Guillain-Barré syndrome where you get all your muscles paralyzed. Similar to that in children, I'm sure Junaid and Ladina can touch on that, Kawasaki syndrome and toxic shock syndromes. Now, on that, once the system is down, then they are more prone to get secondary infection. Could be bacteremic, could be fungal. As you all know that recently from India, you had a lot of a black fungus infection called a mucormycosis, and that be related to again immunosuppression and probably large dose of steroid use for this treatment. Now, touching basically about thrombosis. Thrombosis means again a clot in the arterial system and venous system, and it can cause you pulmonary embolism that make shortness of breath and chest pain, clot in the legs, and you can have stroke, and then you can have a myocardial infarction. Even you can have an ischemic link where it's an emergency to save the leg at that time. Otherwise, you may lose it. It is seen more in ICU ventilated patients, around 10 to 14%, and the risk is quite high in the beginning than the last. That most likely because we detect this clot and we are treating it, and we are also giving the sick patients a prophylactics to prevent the clots, so that incident is less later when compared to early. So most of the patients are asymptomatic, and they are because they are maybe sick with the other symptoms of COVID, so they may not be recognized in the symptoms. And this is less incidents are seen in non-ICU patient. Again, the postulation could be the inflammation could be playing a big role in this. So we have to wait for more data for that. Now, COVID per se, pulmonary embolisms or the arterial clot or thrombosis is much more common in males than females, and it's obesity and other comorbidities like which I mentioned before, and they all have a high D-dimer on investigations. Now, coming back to we all know about this COVID vaccine related thrombosis. It's a different, totally different from the clot, what I just told you. And it's rarely seen, but it's still being described. And the recent CDC data published in April 21 this year says that 15 patients per 8 million of persons who taken the vaccine have maybe underreporting because of the various nature of looking into that factor. And here we can see that in the initial data, it was the females were more than the males, and it is younger age. But now the data are coming up. The male is also equal in both these incidents. So we have to wait for a few more data to come out to see whether it's male or female predominance. Now, when we should look for this adverse effect? The median days is 14 days from the first vaccination, and the range from 5 to 48 days. Now, as I said, this can happen in both arterial, where the blood is collected the blood is pumped out after purification, and the venous side of the blood is collected. So it can be cerebral, we can have stroke, in the legs, and in every system, any part of the system, it can get a clot. So it's a very severe condition which we have to look for it. Now, can we look into that? Yes, of course, we can have a warning sign of this. And if any of the signs which you have, headache, all the symptoms I prescribed, you have to call your local doctor and look for a blood test which shows a low platelet level. That's called, and you may have some bleeding, maybe versus a small petechiae, means small spot of blood seen in the body, and you can have another high D-dimer. Again, is a inflammatory marker, and you got a fibrinogen level. And most important thing is we measure a platelet factor 4 antibody testing, which is more diagnostic. Now, this scenario, the clot, what is caused here, mimic to another different clot, which we come across in our clinical practice, which is called as HIT syndrome, which we come across those patients when we anticoagulate or make it blood thin for various reasons by using heparin. So it's a autoimmune mediated reaction. So we again think could be mostly immune related here. And definitely to confirm whether the clot is in the brain or in the lung, we have to go for a appropriate scanning of the part. So these are the main complications of the lung related symptoms. Thank you for the time given to me, and I'm happy to take any questions at the end of the session. Jazakallah khair.
Thank you, Dr. Ali, for that presentation. Definitely very important given that COVID, the major organ that it affects is the lungs. All right, I'll just share my screen again. Okay, now our next speaker is Dr. Imran Kassam. Dr. Imran is a cardiologist who specializes in heart failure, syncope, arrhythmias, and much of the wide variety of cardiac presentations. He also has extensive experience in procedural work and also does implantation of pacemakers and defibrillators. He works at the Macquarie University Hospital, where he does perform his procedural work and also works at Griffith Base. Dr. Kassam is involved in teaching medical students and supervising trainees as a conjoint lecturer at UNSW and Macquarie University Hospital. So Dr. Kassam will be briefing us about COVID and the heart. Please welcome him.
Assalamualaikum everyone. So I'm just going to try to share my screen. Let's see if I can. It's not showing me my presentation, Faiza. So like if I'm doing the share screen.
Yeah, we just saw your screen.
Oh, you did?
Go to
okay.
You have to start again. Yeah, it's coming.
Did you see it? Okay.
Yes.
Now he'll click your sub.
Okay, that's fine.
That's it.
Okay, so look, with the short amount of time, we'll just go through cardiac related complications. As Faiz already mentioned, I work mainly as a cardiac electrophysiologist, which means that I deal with a lot of electrical work of the heart, but we see a lot of cardiac patients with every presentation. Now, globally, we have 210 million confirmed infections of COVID, and they are confirmed cases. So I'm sure there are many more millions that we are missing at the moment, especially in majority of the countries where testing is quite difficult to do, more than 4 million deaths already. If you look at Australia with the current pandemic, our numbers have increased significantly now, and a lot of patients have been admitted into ICU. And now the death rate is also increasing as well. Good news is that our vaccination has picked up. We already vaccinated more than 10 million people with the first dose. And I think by mid-November, hopefully we can vaccinate 70% of patients with both dosages, hopefully. Now, COVID-19, as Ali and other colleagues of mine have mentioned, is a family of coronavirus. It's called SARS-CoV-2. We already had SARS and MERS in the past. This one is particularly more infectious and more lethal, depending on if it infects majority of the people in one setting. It causes a lot of vascular inflammation, and the problems and complications we see are in relation to that. Just like influenza epidemics in the past, even though it's a respiratory virus, but majority of the patients actually die of cardiac complications. And patients who already have cardiac problems, they are sitting duck for this virus unless they're vaccinated. I'm not going to go into significant details because I understand that the audience is not just medical. There are a lot of non-medical audience as well, but the majority of the problems that occur with this virus, as Dr. Ali already mentioned, are respiratory and clot related, but in terms of cardiac, it can cause myocarditis, which is inflammation of the heart, which can mimic like a heart attack. It can disturb the electrical rhythm of the heart and can put patients into arrhythmias. Even when the patients get non-cardiac problems, such as lung problems, kidney problems, they can end up with cardiac complications as well. As is already mentioned, it enters the body by ACE2 receptor. Now, initially when this was detected, there was a bit of a panic that currently we use medications for blood pressure, which works through this channel. And there was a concern that maybe this might cause problems with those medications. Those concerns have been put to rest, and that's not the case. The virus then enters into the RNA and DNA of the body and makes every organ sick. It is very important that patients who are on medications for hypertension, diabetes, they continue to do so current settings and not avoid and increase their compliance. Because if they have risk factors, then the risk of getting serious COVID disease is higher than the patients who don't have comorbidities at the same time. Now, patients who get admitted into the hospital, about 20% of them develop cardiac complications. And as I've already mentioned, they get damage to the cardiac muscle, which in results cause problems with their multi-organ problems. They can go into renal failure, require dialysis. They can develop what we call ventricular arrhythmias, which are quite significant and can be lethal in certain cases. In hospital mortality in patients with myocardial injury, in patients with COVID is 50% compared to 5% in patients without these problems. So you can imagine that having cardiac complications make the patient profoundly sick and increases the risk of mortality. Now, one of the problems that we are experiencing at the moment is patients with heart failure, because patients with heart failure can get shortness of breathing, and they can feel fatigue and tired, which are similar to patients who get COVID. So one of the challenges, if the heart failure patients get COVID, is it heart failure worsening or is it COVID? One of the predominant risk factor we have seen is the fever. So it's like a discriminating factor. If they have fever and other things that Dr. Ali mentioned, like loss of smell, loss of taste, sudden deterioration, then it's most likely COVID, especially if they're in the area where the tendency or the risk of infection is high. One of the easiest thing is always to do a COVID test to be on the safe side and consult with your cardiologist or GP. Currently, we have problems in terms of not being able to do face-to-face a lot of times. So remote monitoring is available and would be a good idea to just have a chat with your GP. One of the most common arrhythmias we see is atrial fibrillation. I'm not going to spend too much time because there's too much detail in cardiac complications. What I wanted to speak to you about is when patients get COVID or when the COVID is common in community, patients tend to avoid their regular cardiac checkups. And it has been seen around the world that there has been reduction in patients presenting with heart attack. And it's not only because there are not many heart attacks, it's because patients are sitting on their symptoms. So it is very important in the current situation where we are concerned about COVID, but we also worry about that if somebody's got chest pain, shortness of breathing, don't sit on it, consult with the GP, or if you feel sick, then go to the hospital. One of the problems is we also see increase in rate of mortality because of the non-COVID related complications, and we don't want to see that. Incidence of MI is always going to be there, and we are seeing actually much more sicker patients presenting to our rooms because they're avoiding going to the hospital, and we also see late presentation after they already had a heart attack at home as well. So please don't ignore the symptoms. There are National Society guidelines available for all doctors as well on Cardiac Society of Australia and New Zealand as well. Now, in terms of the procedures, just briefly, we are still conducting all the cardiac procedures because as most of them are urgent, so requiring an urgent pacemaker, treating acute myocardial infarctions, heart attacks, heart failure. So we're still treating that. The only procedures we are delaying at the moment are elective ablations for atrial fibrillation or other non-significant arrhythmias. The last few minutes I wanted to spend on vaccinations, because there's a lot of concern about cardiac complications and, should we get vaccinated or not? In any situation, COVID-19 infection is much riskier than anything in relation to vaccination. So that's to put it in perspective. So vaccination risk related complication is much, much lower, and it only occurs in very small amount of population. And majority of the time, the complications are not severe and they're self-limiting. So with Pfizer vaccination, there has been incidence of very low risk of pericarditis, especially in younger people. It had seen in the US. We haven't had that many Pfizer vaccinations so far in Australia, but we are keeping an eye. We definitely are seeing patients with both pericarditis and myocarditis, and in relation to both vaccination, both AstraZeneca and Pfizer. And there's some Moderna coming, so similar, but very rare cases, and usually self-limiting. Very rarely we have to admit patients to the hospital. Despite that, we don't interrupt the vaccination course. Once they get better, they go back and get their second dosages as well. They also get some mild arrhythmias, which again can be treated with medications and are not severe as well. Now, vaccinations have no effect on underlying cardiac conditions. So any cardiac condition that a person might have, it actually increases the risk of COVID-related complications. So it is very important to have the vaccination. A lot of times people ask that if I'm on blood thinners, should I be vaccinated? You are absolutely all right to be vaccinated while you're on blood thinners. Very rarely you may bleed or bruise a little bit on the injection side. If it gets too significant, then you can always do compression, and that usually settles it down. Allergic reactions in relation to vaccine are similar in both patients with cardiac and non-cardiac problems. Now, risk of serious COVID disease is almost 100 times more in patients with underlying cardiac disease. So if they have ischemic heart disease, heart failure, arrhythmias, so more important to get vaccination as early as possible. There are no known cardiac contraindications to vaccination at this stage. Now, multiple vaccinations such as flu vaccine, pneumovax, they can all continue at the same time while you're having the, the COVID vaccination. Of course, there has to be a gap in between the vaccination, but multiple vaccinations are preferred at this stage. Both vaccines are very protective, especially with the Delta virus as well. We don't know how effective with newer variants, but currently we don't have those variants in Australia, so I would not worry about that too much and just get on with the vaccines which we have available at the moment. All of them are 90 to 90% effective in relation to serious COVID infections. Now, down the way, it is possible with certain vaccines, we may need boosters. And currently in America, they've approved it for vulnerable patients. There's also document that immunosuppressive patients, as Dr. Ali mentioned, somebody with transplant, they're actually the most highly susceptible, because that's where the virus goes into the body and makes enormous amount of copies, and the virus replicates and changes the variant. And these are the patients who are actually at highest risk of changing the virus and reintroducing into the community. So anybody that with any pediatric population with immunosuppressive tendencies, they all should be vaccinated. I think I will just pause on that, and I'm happy to answer any questions at the end of the talk as well. Thank you very much.
Thank you, Dr. Kassam, for that talk. Certainly, it's really interesting, not just that you can have cardiac complications because of COVID, but that because of COVID and the fear of COVID, a lot of people aren't actually seeking care at appropriate times, and therefore you can get more severe heart conditions. And we certainly see that across specialties, including late cancer diagnoses as well. All right, I'll just share my screen again to introduce our next speaker. Okay, so our next speaker is Dr. Junaid Sheikh. Dr. Junaid is a consultant pediatrician and head of department of Paediatrics at Westmead Private Hospital. He also works at Blacktown and Mount Druitt Hospital. He serves as a senior lecturer at the School of Medicine and the Western Sydney University. And I'm actually familiar with him during my training at Mount Druitt during my resident years. Dr. Junaid has been involved in various community activities as well. He's of Gujarati Muslim heritage, and he was one of the founding members and ex-president of the Gujarati Muslim Association of Australia. He's currently an active Shura member in that community. He's also been involved in various community activities such as fundraising events, blood donation camps, domestic violence workshops, youth career seminars, and helping to settle migrants in the community. So please welcome Dr. Junaid, who will give us a briefing about COVID and children.
Thank you very much, Faizi, for introduction, and thank you very much for AMIA to inviting me to present COVID in children. I will be running very fast, sorry for that. There's lots of information I just want to throw, so please bear with me. So introduction already has been mentioned. This is the third time in this century the world faces a new highly contagious virus strain spread across the globe, causing numerous deaths and catastrophic economic impact. The first pandemic was in 2002, was in China. Second outbreak was in 2012, was in Saudi Arabia. And this is the third pandemic which was started in December 2019 in Wuhan, which was labeled by WHO in February 2020 as a novel coronavirus pandemic. Case fatality rate is around 2 to 3%. And the first pediatric case of COVID infection was detected once again in China in January 2020. If you talk about the incidence of COVID-19 infection in pediatric patients, according to ESA data, is around 14.2%. And if you talk about the world data, it's around 1 to 5% of total case numbers. 90% of the children, fortunately, get asymptomatic or remain asymptomatic or get mild to moderate symptoms. More common in 12 to 17 years of age rather than 5 to 11 years of age. There's a study from USA where the 2,500 cases, 15 children needed intensive care admission and 3 deaths. And the second study from Canada and USA where the high-risk pediatric patient where the ICU admission rate was pretty high, 38%. If we talk about the mortality, in UK, there were 25 pediatric deaths in children under 18 years of age. If you take the total caseload, it's around 2 deaths per million. If we talk about America, it's around 0 to 0.25% mortality due to COVID-19 infection amongst 43 states, and 7 states reported 0 deaths due to COVID. Kids under 1 year usually get severe illness with underlying condition, such as chronic lung disease, underlying heart defect, neurological condition, and other disabilities. Mode of transmission of virus is similar to adults, so it's a respiratory droplet and close contact. Younger children most likely transmit infection to the older. With alpha variant, it was less likely the kids were transmitting, but with the Delta variant, kids are transmitting a lot. You can come across in the news that there are 28 to 30 child care has been shut down because of infection occur in the daycare. Incubation period, roughly around 2 to 14 days, with the alpha strain with a mean of 6 days, and with the Delta strain is slightly shorter. So clinical manifestation, if we talk about the pediatric patient, they usually, large proportion of the children who get COVID infection, they are asymptomatic. Those who get symptoms, the presentation will be the fever, nasal congestion, dyspnea, sore throat, diarrhea, nausea, vomiting, headache, myalgia, poor feeding, and loss of sense of smell and taste. They can present as a diarrhea as well. One of the case study in the China describes that they were. This is the data from the China once again, 2,500 children who had a COVID infection. You can see the 51% patient presented with the mild symptoms, 39% presented with a moderate, 5% had severe infection, severe symptoms of dyspnea, hypoxia, needed oxygen, and central cyanosis. Amongst those, only 0.6% children needed sort of respiratory support along with the multi-organ dysfunction. This slide shows basically symptoms in children. I divided in broadly 3 categories: children less than between 3 to 5, 6 to 11, and more than 12. As you can see from the red bars, the fever and the cough is predominant in this category. In the older children, they do get dyspnea on the top of dyspnea, headache, and cough and fever, again, the common in this category. Diagnosis, all of us very well aware about the COVID swab test. Normally, we don't do other investigation in asymptomatic and mild asymptomatic, but occasionally they can get some low white cell count and lymphocytopenia. You know, these cells are the little fighter cells in our body. They can get some chemical rise in the blood, which called C-reactin protein, ferritin, and very rarely the chemical we call the D-dimer, which basically common in children who gets clot formation. We have seen a couple of patients where they presented, usually adolescent presented with a myocarditis. The presentation symptom was the chest pain, and if you do the troponin level, which is one of the chemical comes from the heart muscles, can be rise. So they can have lung involvement, as Dr. Ali mentioned, in the adult patient, children also can get lung involvement. If they get lung involvement from this X-ray, X-ray A and B, usually they are the mild sort of abnormality. B and C is showing the part of the lung involved is called consolidation or pneumonia or lobar pneumonia, or they can have a diffuse involvement in both the lungs as well. Medical management, if we talk about milder symptomatic COVID patient normally can be managed at home with a strict isolation, paracetamol for fever, adequate hydration, and educating parents about what to do if the child gets worse in terms of dyspnea, hypoxia, severe sort of myalgia, and persistent high-grade fever.
Sorry to interrupt you. You're using slides?
Sorry?
You're using slides or not slides?
Yeah, the slides. You can't see the slides?
We can't see that. No, only you can see you're talking. That's what somebody asking.
Oh, really?
Yeah, sorry about that.
I already saved the screen.
Okay, no, it's not coming up. Sorry to interrupt you.
All right. So I already shared the screen, Ari.
We can't see here. Do you want to try one more time, please? Go to share screen and then click the.
Can you see now?
It's coming up. Yes, good.
You can see. Oh, sorry. You
yes, excellent. Very clear. It's very clear so far. Okay, that's fine.
Can I go back? No, you can
fine.
continue. Your talk was good. There was no without slides.
I'll go back. I'll go back from the X-ray.
Yep, that's fine. A and B.
So these are the X-ray changes. Sorry for that. So the children can present with the lung involvement as well. They can present as a pneumonia, the part of the lung involved, which we say consolidation, or they can have a diffuse involvement as well. So I was talking about the medical management. The milder symptom children can be managed at home with the paracetamol, maintenance of the hydration, and training parents to recognize the worsening symptoms and come back to hospital. Children with the moderate and severe symptoms usually needs hospitalization. So if you talk about the medical management, there's no magic bullet, no silver bullet. We all of know. Again, the same concept, social distancing, mask for children more than 2 years as guidelines given by American Association of Paediatrics, strict hand hygiene, and vaccine. I know the vaccine will be taken by Habib. I hope he will cover all the aspects of the vaccination. Children who are hypoxemic, they need supplemental oxygen. Very, very rarely they need mechanical ventilation. Steroids does help. If they have the lung involvement, it does reduce the mortality. Very rarely they get clot disorder. If their chemical called D-dimer is high, they need some anticoagulant therapy. Lots of people must have heard about antiviral medication called remdesivir. Yes, it can be utilized in children if they have lung involvement with oxygen level less than 94%. It does reduce duration of the symptoms 10 days versus 15 days. Lots of discussion about the other drugs in 2020. All of us are aware that, chloroquine, hydrochloroquine, azithromycin, ivermectin, they are not indicated or not recommended at this stage. This is the new world, monoclonal antibodies. What are the monoclonal antibodies? They are the laboratory-made proteins that mimic immune system ability to recognize those harmful antigens and viruses. In pediatric age group, efficacy and safety is not established yet, but FDA in USA has approved to use this new monoclonal antibodies. It's called Sotrovimab, which can be used in children with 12 years. I just heard in the news for the Australia, I think government has approved to use in currently for the adult more than 55 years. This is a new entity. It's called multi-system inflammatory syndrome. In mid-April, over in UK, in London, I think there were a cluster of the cases in the children. They basically presented after the COVID with some sort of the shock and hyperinflammation. You know, some of you might have heard about the condition called Kawasaki's disease. We see these cases quite a few times every year, where the children presented with high-grade fever and some other clinical signs. So very similar to that condition is called multi-system inflammatory syndrome. Very rare condition, although there are 1,000 cases reported in USA and 20 people died. There's a CDC guidelines for that. I won't go into detail, but this is a slide which covers the multi-system inflammatory syndrome in children. You can see they can have persistent high-grade fever, they can have red conjunctiva, red lips, they have rash, peeling of the skin, they can lymphadenopathy, they can have a lung involvement, and they need oxygen. Again, they can get myocarditis, chest pain, blood pressure can drop down, they can go into shock. They can have some blood disorder and gastrointestinal symptoms. Normally, they do well if they treat early with the intravenous immunoglobulin, dose of steroids, a large dose of steroids and aspirin. COVID in children with other comorbidities. These are the children that need mainly intensive care admissions, underlying respiratory, heart defects, and complex neurodisability. These are the children, they usually get more sick with the COVID based on the papers presented from the Europe and the US. Now in Sydney, if you talk about Sydney, we have a Sydney Children Hospital Network. They started providing this amazing service to local health districts. It's called Home in Hospital. So what they provide outpatient service. They also provide the care. Those children who need the care under 12, their parents are in hospital and no one can look after them, plus children with the COVID positive disabled children. So they started doing this outpatient service. It's called Virtual Kids COVID Outreach Response Team. There's 1-800 number there. It's a 24-hour service. Parents, if any of the child gets COVID positive and they want any need 24 hours, they provide service. Sometimes they call the patient in the emergency at Westmead Children's Hospital and provide help. Currently, they have 700 patients till last week. Very few of them need hospital admission just for the IV fluid, management of chest pain, and 2% of the children need some AD assessment. There are some other local health services also provide this type of the services. When do the children return to sports after COVID positivity? So asymptomatic and mild COVID-19 positive children, if they have a negative swab, 10 days after the swab, they can start or resume their sports activity. Those children who had a moderate or severe disease, they should not exercise until unless they are cleared by the cardiologist. When to return to school? $1 million question, hey. Only those two ladies can answer this question. We don't know when. So we'll talk about impact of COVID on children. It has created enormous impact on the kid. You know that schooling, online schooling, educational disruption, lack of social contact, no sports activity, no exercise, they're missing their friends, their relative, and online schooling or homeschooling is a major burden for the parents as well. Very commonly, even the normal children can have behavioral issues in this COVID lockdown. And this has been documented from this study. Children with a behavioral disorder, especially ADHD, autistic children, and intellectual disabled children, they can have more behavioral issues as compared to the normal kids. So effect of COVID on Australian young people. This is the survey done by Mission Australia in mid last year when we didn't have too many COVID positive cases here in New South Wales. And the top three concerns raised in that survey by the young kids, where the 34% raised the issues about education, 70% raised the issue about mental health, and 21% were worried about isolation. Some of the tips for the online schooling for the parents. I know it's very difficult. Online schooling was never a good idea. So in this COVID lockdown, we have to do that. Some of the tips for the parents, they can have a plan and follow the routines. Don't be too rigid. Just be creative. Let the child do whatever they want to do in terms of online. Help them, support them, praise them, encourage them. If you stuck up, just talk to the teacher, take the feedback, get some resources, and use some reward system. Strategies for mental health issues in kids in home setting. Do not use the word that my kids are getting bored, they are getting frustrated. If you use those words, they are going to use against you. So please don't avoid using those words. Encourage them to do more physical activities, so walking, running, bike riding, at least regularly every day. Engage them in activity. Give them some duty. Engage them in cooking, baking, gardening, all the stuff. Just to get them involved, that will give them some sort of reassurance. There are this thought buster card you can find on this goeson.com. They are the printable cards. Use those cards. Let them bring out their thoughts. These cards are very amazing, used by the psychologists a lot. So that way they can express their frustration rather than it come as a behavior. Again, the same people has given this nice program to reduce the stress and build up the resilience in the children. These are the animated program, research-based, and they can sit down and do that, and they're really wonderful program as well. Government has done a lot for the mental health, and they pump lots of money for the children with the mental health issues as well. Lots of people are providing these services. Major provider are the Headspace, lots of other associations. The details are here, like Smiling Mind, Beyond, Youth Beyond the Blue, Bite Back, Reach Out, Kids Helpline. And if you want, you can do online Triple Pooey or 123 Magic program to acquire some of the skill to handle the children behavior in this difficult time. These are some of the resources for the parents, carers, and teachers, again, for the mental health issue, to support the parents and to support the kids. So conclusion, so COVID-19 making an unprecedented and devastating social and economic impact. Affected children do not appear that sick or unwell, and this is the new condition, multi-system inflammatory disease, which is very unique in this pediatric age group. And as the pandemic continues to evolve, it is still hard to fully assess or forecast the long-term impact on the adult as well as the children's well-being. Vaccination is very, very important tool to protect the community against the COVID. Thank you very much.
Thank you, Dr. Junaid, for that really Thank you, Dr. Junaid, for that really interesting talk. Not just focusing on the complications due to COVID on children, but the fact that children are dealing with the brunt of this in terms of the social isolation and the psychological impact that it's having on them. And I think it's really useful that you gave us all some practical tips that parents can use with their children. Okay. Just try sharing my screen again. Sorry, I think I might need Dr. Shahir's help. Just for some ideas.
Stop. Dr. Junaid, can you please stop the screen share? Or you can just start the screen share, it will go, the other one will go away. Faizi, Junu, you can start the screen share, that will stop this screen share.
Okay, sure.
Yep.
Thank you for that. All right, welcoming our next speaker. So Dr. Habib Bhurawala is the head of pediatrics at Nepean Hospital and also the clinical lecturer for pediatrics at the University of Sydney. He has a keen interest in health promotion and he's really involved and active in his community. He's a health coordinator at the Indian Crescent Society of Australia and also the Central Executive Committee member of the Australian Islamic Medical Association. Please welcome Dr. Habib Bhurawala to brief us about vaccines and their advantages.
Assalamu alaikum. Thank you very much. Can you hear me?
Yep.
Just try and screen share. Can you see the slides?
We can.
Okay, thank you. Thank you for the introduction and also for the opportunity. Assalamu alaikum everyone and Bismillahir Rahmanir Rahim. Thank you to all the speakers. I think we've heard enough about COVID, what it does to the lung and heart and also children. And we've also heard the role of the vaccine potentially, given we don't really have any definitive treatment. So I think it's important now to just focus on the vaccine, and I'll try and, rather than spending a lot of time and around the basics and so on, we'll try and tackle some of the topical issues which people often ask or worried about. Some of that has been covered already earlier by other speakers, but I might touch quickly. So just going back to really basic, and I think most of you know this, but I'll just like to highlight, how the vaccine works, and it works like COVID vaccine works like other vaccines, and the children have been receiving vaccines for a long time, and we do know the vaccine preventable diseases and how that has helped, especially many of you come from India and those areas, and certainly can see the changes, how the vaccination has helped in many other diseases. So it's the same principle. And in terms of the COVID vaccine, what it does, it does take a part of the coronavirus code and puts in a vector or in a synthetic made vaccine. So there are two types of vaccine, and I'll talk about it just in a second. It just goes into your body, and then your body makes antibodies against that protein, the spike protein, which the coronavirus have. And then it remembers, and if you have an infection, it just goes and fights. So it's simple principle, pretty much the similar than what the vaccine generally is supposed to do. And the two vaccines we have now, which we're going to mainly focus on, is Pfizer and AstraZeneca, and they both have different technology. They've been manufactured and how they work. And then there is a third vaccine, which we've just heard, which has also been approved, Moderna, which is going to be, I think, available from next month, is very identical to the Pfizer, so that they both have quite similar action and also the eligibility and so on. But we'll mainly focus on these two vaccines, which we have available right now. And just touching first to how the Pfizer vaccine works, because that's going to be the mainstay. I think after next month onward, we now have more Pfizer supply, and it seems to have been quite effective. And I'll show you some data as it works. I've spoke to you about. So this is an mRNA, a small part of the virus genetic code, and then we're just trying to make into the vaccine. And how it does it. So this is a spike protein here. This is a coronavirus. It's just an animated model, and that part has been taken and try and put into the body of the person after manufacturing as a vaccine. So then the body actually starts to prepare antibodies, because it reacts and prepares the antibodies, the fighter cells, to destroy. And then if that person gets COVID later on, it's going to trigger the response and fight against the infection. So it's pretty much the spike protein, if you remember this bit, which is going to help us, our body, to remember. And how the other one works, the Oxford vaccine. So what it does, it uses what we call a vector. So it's a chimpanzee adenovirus, which has been modified. So it's adenovirus from the chimpanzee's flu, which is quite harmless. It's been made in a way that is harmless in humans, and it doesn't replicate when it goes into the human. All it does, it just helps getting the code into the body. the genetic code into the body just as a vaccine. So it just helps as a vector. And then again, when the vaccine goes into the body, it uses the code, produces the spike protein, and then body generates the antibodies and remembers it. So next time when you have an infection, actual infection, it fights. So the basic principle is similar, it's just the way it's been manufactured, both the vaccines. A lot of people do ask this question, and I think it was, discussed earlier, also in the initial introduction, that how it was developed so fast. It is because I guess there was a huge amount of funding, there was a lot of collaboration everywhere in the world, lots of people were working at the same, and it was, I think, unprecedented amount of work which has happened, and all the support was available, including lots of government funding and support, which otherwise wouldn't have been possible in other vaccines, and that's why it was made really fast. Some people also say that how come that, the mRNA technology, which is completely new, how did it suddenly happen and they made a vaccine when nobody knew about it? There has never been a vaccine. Actually, the mRNA technology was around for, I think, close to 17, 18 years, since 2002. The concept was known, and it was tried once or twice to make some vaccines. It didn't work out, and there wasn't really much research happening in that area. And this time around, I think for one of the vaccine manufacturers, the US government given $1 billion to make it. So there was that amount of funding which helped. And that's how it was made. There's not, and the adenovirus technology as well, the technology was around as well. So it wasn't something completely new. Another question, which a lot of people have asked me, and I'm sure many of you might have the question, that is ingredients in vaccine. Is it halal? Is it permissible? And there are two vaccines. And the current guidance we have, what we know about it in Australia, both of the vaccines don't have any animal meat or egg products. So what they have is, they have a salt water, normal saline, they have some sugar, they have a emulsifier in one of the two vaccines, and all they have is that protein which we spoke about, spike protein. And often it's been enveloped into the fat globules just to go in, and that's about it. So it doesn't have anything which we don't know. Obviously, it's complex. There are lots of small components, but primarily, it doesn't have any of those which has been discussed or been mentioned. And if we look at some rulings and we just look at some of the authorities or organizations around this question, so I'll just put two of these. So the Australian Fatwa Council, the National Imam Council also have given an opinion, given a fatwa, and they've concluded that make use of medical treatment for Allah has not made a disease without accepting a remedy, as Brother Aflah initially mentioned as well. And they certainly have concurred that they would go with an expert and expert opinion. They've consulted Muslim doctors and medical experts, and they said it's fine, it's okay to have it. Same has also come out from British Islamic Medical Association, particularly around Pfizer, but also they said about AstraZeneca as well, and many other scholarly bodies. So I think that puts that doubt to rest. The next question is the vaccines are safe? And why I say that is that we have that independent therapeutic good administration who regulates all the vaccine, and the vaccine in Australia have gone through the same process. They didn't have an emergency use authorization. They went through the more rigorous process, which is called a provisional authorization, which leads to the complete authorization. And and they are monitoring the safety data at the moment as well. So they constantly monitor. And that's why some of the advice also gets changed depending on some of the reactions and some of the others. So it is being monitored and it is safe because there are experts who've looked at all the data. And also it was looked overseas when the initial trials happened. This is the key question. What do vaccines achieve? And I think when we think about any vaccine, we have to think about what it should do. So it should stop people who catch COVID from dying. It should reduce the risk of severe disease, especially somebody, symptoms so bad that they have to go to ICU. And we've heard from other speakers what it can do, the risk of going into ICU and death if you had a heart problem, if you had a lung problem, if you had other problems, such problematic. So you want to stop that happening or reduce it significantly. And the third is going into the hospitalization. And we've been hearing every day as well that lots of places, the hospital system is stretched because they cannot cope with the hospitalization. So you can have COVID, you may get COVID, as long as we can convert that severe illness into a flu-like illness or something which can be managed outside the hospital, that's another purpose of what we want to do. So if a vaccine is doing more than these three things, is a bonus, but that's what it should be doing. And that's what I think we're trying to see. This is a recent data. This is probably the latest I can find. This is from the hospital in New South Wales. And I'll just want to show you the vaccination. So 759 people were hospitalized, and this is still up to 7th of August. This came out on 13th of August. So this is the latest we have. It comes out, I think, next week again, the new data. And what it's showing is, if you look at this table, the fully vaccinated people in the hospital percentage, sorry, the number 16 and percentage 2.1% versus those who didn't have vaccine, 669. ICU, how many fully vaccinated were in ICU? 0, that's on 7th of August. 9 who had partial vaccination and 98 who didn't have vaccine. So you can just see, I think it speaks for itself. I just want to show you what the vaccine has done so far in New South Wales. And this is another, some other charts I just want to share with you, and it's similar. And this is from Doherty Institute report, which was presented to National Cabinet recently. And it's a combination of international data, but also the local data, and looking at the whole of that. And again, it shows that both the vaccine, the Pfizer and AstraZeneca, you can see quite comparable result, really good result, protection against death, 92 and 90%. It is not 100%, it won't be, because also there would be some people who may not respond to vaccine, the non-responder, very small number, but it would be there. And also, at times they have other comorbidity, they have other problems which makes them going into ICU and death, not always COVID. It might complicate or it may progress it. So it's just useful to know that it's not 100% because of some of those reasons, but you can see the reduction. And also there was a question, I think, also put in a chat box. And also I just wanted to highlight, we are having new variants, and Brother Mohammed spoke about it. So we have now Delta, which we're worried about. And there are some data from other countries here. So this is England, Scotland, Israel, and Canada. And if you see this is Alpha and this is Delta. This is Alpha, the red is AstraZeneca, the blue is Pfizer, and I think the yellow is Moderna. We don't have Moderna at the moment yet, but it also shows that for all of these, there is some reduction in efficacy against symptomatic infection and hospitalization for some of those, but not as bad for the hospitalization. For the symptomatic infection, means you have symptoms of COVID, the vaccine still is protecting, not as well as Alpha, but still is doing the job because it's still protecting. And we have to watch this as it goes along. The more we have vaccination, we potentially can reduce the more variants, and vaccine may still continue to work. But you can see that it does reduce, but it is working. So it's just important to know that it's still effective. So the more we have vaccine, I think the better chance of having less problematics. Just a couple of quick touching base before we conclude, and it is important as well because there are a lot of community members who worry about should they have a vaccination during pregnancy, breastfeeding, and there is a good data now and good advice from College of Obstetrics and Gynecology in Australia and also the Technical Advisory Group of Immunization. They both recommend that pregnant women should routinely be offered Pfizer vaccination at any stage, they say, because the severe outcome is significantly higher for pregnant women and unborn baby. And we do know from international data that preterm labor, the rate of babies going into intensive care, and also the mother's complication around peripartum period, so period just before, during, and just after labor, the complication increased with COVID. So it is recommended. Also, and there is a data from UK and others as well, and also during breastfeeding. If you breastfeed as well, it's okay to have the vaccine. It doesn't have a problem. In fact, the other thing I should mention is if you are pregnant and you have a COVID vaccine, it does actually transfer some of those antibodies to the baby via placenta, and also it is protective for the newborn baby. So in fact, there are more than one reason why you should actually consider actively. Other question I have also want to highlight is, it's not on this slide, but it is also been mentioned on the RANCOG, recommends that those who are going through infertility treatment or those who are worried about infertility due to vaccine, again, should have the vaccine. It doesn't cause infertility. And in fact, while going through other treatment, obviously you speak to a health professional, but it is important. Vaccination after infection with COVID, the recommendation is yes, you should also still get vaccinated because still is a new virus. Still, we don't know how long natural immunity might last after the infection. And also we know that our protection from reinfection may reduce over time. So it's sensible to have the vaccine to boost the immunity and also to make sure the protection lasts longer. I won't go a lot into the side effects. I think Dr. Imran has touched a little bit on as well as Junaid. There aren't that many side effects. The myocarditis and pericarditis is been described with Pfizer. When I've looked at the data from TGA website, they're saying 4 cases of myocarditis and 15 cases of pericarditis have been reported to the TGA. So the inflammation of the heart and inflammation of the heart membrane. And then you can think about that is that the data is up to 2 million, and you can see is now, it's almost double the dose. So it's very minimal, very safe, and risk of having those heart problems after with the COVID is much higher. And there is a rare risk of blood clot with AstraZeneca, and I'll just show you a graph. This is the number of AstraZeneca doses in Australia to date, 8.1 million. This is just been updated, so 19th of August, okay? Very recent. How many clotting cases? 112 of 8.1 million. And death, 6, 1 in 135 million, 0.0007%. It's so uncommon, the benefit is so much. We really need to, I think about this and don't worry about this because it's so rare. And I'll skip this. So just the summarizing again, it is effective. The side effects are mostly mild to moderate. The vaccine is safe during pregnancy, during breastfeeding, doesn't cause infertility. It is permissible or halal. And I think we should really take that as soon as possible without worrying too much. Dosing interval, I think there were some questions. Dose interval was for Pfizer was 3 weeks. Now it's been recommended in New South Wales to extend up to 6 weeks so that more people can have first dose. I think it is within still permissible and the technical advisory group recommends it. For AstraZeneca, it was longer. Now it's been brought forward between 4 and 6 weeks, again, to try and see that more people can get full immunization sooner rather than waiting. I think that's the recommendation. There are different intervals being tried and still it does offer the protection. So we should look at that. And I'll just leave this last slide. So if you want to talk to someone about COVID vaccine, there is a coronavirus helpline. And also you can learn on the Department of Health website. There is information available in 63 languages. So, and you should always talk to your doctors or healthcare professional. So thank you very much. Sorry, I did go a little bit over time, but I think it was important. Thank you. I might stop there.
Thank you, Dr. Habib, for that very informative presentation on vaccines. I'm sure it was sort of the most awaited topic for everyone, given the number of questions we're getting as well. So we can see a lot of questions in the chat box, and just a reminder to anyone who has any questions, please do put that in the chat box. This is meant to be for benefit of our community, so please do ask away. All right, now I'll just share my screen again. I might just need some help with screen sharing. It says I cannot share while other participants sharing.
Habib, Habib, can you disconnect? Not share it? Or stop sharing?
If you start sharing, that will go close.
Unfortunately, it's persisting.
Okay, I just okay, now can you do it,
Yes, now it's working.
Okay, thank you.
Thank you, Dr. Habib, for your presentation again. Okay. All right. right, so moving on to our next speaker. Our next speaker is Dr. Siraj Hameed, who is a general practitioner with immense experience working in the Middle East, having worked with the prestigious Johns Hopkins, Aramco Healthcare, and also now across Australia. He consults all aspects of general practice and has special interests in chronic disease care and mental health. Being a GP, we know he is at the front line dealing with this outbreak and definitely a big part of the vaccine rollout. So he's well expertised in briefing us about COVID and the community. Please welcome Dr. Siraj Hameed.
Yeah, Assalamu alaikum. Can you hear?
Yeah, you can hear.
Yeah, I'll share.
Very nice voice, brother.
Thank you. Yeah, alhamdulillah, what an extensive session has been. Yeah, it has been fantastic. So many specialists in one forum, and everybody has briefed through, say, in 20 minutes each. We had almost 1 hour 40 minutes. Probably you could sit for one full day, and probably we won't get this much of information. So thank you everyone once again. And honestly, I'm left with nothing much to say. You guys have said everything. And for a change, normally patients comes to me first, and then I used to refer to everyone. And for a change, I mean, probably they put me, to summarize in a bit. So thank you everyone. And I'm one of the new members to the community. So I have to thank the effort put by Dr. Ali, Dr. Faisal, Dr. Shair, everyone, and of course the Faizi as well to add in touch, and all the speakers. And thank you everyone. So basically, I won't be taking too much time. Rather, what I would look for is more of a layman perspective. What's the basic symptoms and a little bit of a mental health aspect, and what happens if you tested positive or negative, and where do you go? How is the basic treatment is done? So I will not be going to big terminologies here. Probably I'll just try to keep you guys a bit on a less of medical knowledge, and more of I'll try to give you a bit of a basic layman aspect. All right, so yeah, we'll just go with what is the difference with the strain now. I mean, we all have seen, a big list of basic symptoms. What do you see? What do you not see? So we have seen fever, persistent cough. That's one of the most important symptoms. We always see that. And with the D variant, runny nose has come. Probably I would say like what you see in an Olympic game. Australia this time has gone up almost in 5th place. So runny nose somewhere in 3rd or 4th place. And somewhere down the line, the loss of smell, loss of appetite. So basically, these are the common symptoms. Fever and cough, it's common. Headache, sore throat, the next common. And with the Delta variant, we see the runny nose as more of a, common. And loss of smell, loss of appetite, all the way down. Other symptoms like, we all get the aches and pains, nausea, vomiting, diarrhea, conjunctivitis, a loss of a taste or smell, kind of rashes. So these are the basic symptoms. Anybody who's having these symptoms, what do you do next? Yes, go to the centers nearby, get a COVID test done, and what happens next? Yeah. So there's a lot of guidelines. Who manages what? And at the moment in NSW, basically these all been looked after very well by public health. And I know I did get a few input from Faizi, who is a frontline worker at the moment. And probably I'll ask her to add a little bit in case if I'm missing something for sure. So you go to the local center and you get the tested, and what next? You wait for the result. If they say yes, you are positive, what do you do now? So in that scenario, yes, somebody from the public health will contact you, ask for where exactly you stand, what are the symptoms you have. They will categorize accordingly. Most of us, 80%, 90% of us, probably might be having some mild symptoms. So they have 2 options. Either if you have a facility, they will assess your home setting. If they see that, yes, you are good enough to be inside the house, and you can, we can keep monitoring you. Say, we talk to you over the phone, make sure that your symptoms is not getting worse, follow up on that. So basically any aches and pains, sore throat, dry cough, runny nose, as I mentioned, the early symptoms, you are categorized as a mild. So someone from the public health contacts you, talk to you over the phone, they say, okay, 1 or 2 days, every day we'll call you, and then see how you progress. There's a good chart so that monitor your symptoms and note down your temperature, whether you're having any vomiting, diarrhea, any of the other cough symptoms, and then take from there. So if they see that, look, this person is changing from mild to moderate, they do take action and they do take accordingly. Of course, these are the severe symptoms. Probably you won't be sitting at home and looking for all this. You would have gone into the hospital. But just for understanding, severe shortness, you are feeling short of breath, you can't able to breathe. And they do provide something called pulse oximeter, where you can check the oxygen saturation. And we all are aware now, because with so much of bombardment of information, we know that anything less than 92, anybody in our, I'm sure whoever is listening, they all know that what's pulse oximeter is and saturation and all that stuff. So anything less than 92, yes, you will be inside the hospital. You won't be running around, and your lips are turning face and lips turning blue. Pain or pressure on the chest. So skin becoming cold and clammy. In other words, we say, look, this is probably your pressure is going down. You are having some compromise on your, in any of the organs. So that's the reason. And or you're having confusion or fainting. So these all are severe symptoms. Nobody will watch for this. With a mild to moderate, any of the public health worker who's monitoring you will be taking you or giving you an option. Look, as I said earlier, either you would be at home or one of the hotel quarantine centers. These are the two places they usually put the mild ones, and then they go to the hospital. And once you are there, normally you need to know, okay, 14 days is the normal time period, yes, and then what next? So any confirmed case, anybody who is positive on the throat swab or whatever the investigation is done, 14 days have passed, they have no symptoms, nothing at all. Before the 14th day, they will be given a swab to do a swab so that they are not anymore infective. They're not having a COVID positive. You're good to go. You're fine. Fantastic. Yeah. And second set of people, you are at home, you were monitored, you have been diagnosed with COVID, you have been monitoring some here and there on the 7th or 8th or 9th day. Most of us, we have seen that mild cases get a bit worse during that time. So if you have those symptoms, they will keep an eye on you and say on the 10th day, all your symptoms is gone. So another 3 more days or 4 more days, 14th day, you don't have any symptom for another last 3 days. Before that, they will do a swab on you and say, look, you're fine, your swab is negative, no symptom for the last 72 hours, you're good to go. And the third cases is some of them, probably they're still having ongoing symptoms. They have crossed the 14 days. They have not had any, it's not completely gone. They had a positive test and they still have the symptoms. What do they do? Do they really worry about? Do they have to go into the hospital? No, if they don't have the symptoms, which I said, moderate to severe, no, they won't be going to the hospital. So basically they will be observed for another 20 days in total. And then of course they will do the set of tests 72 hours earlier and then 124 hours earlier. Again, there as well, good to go. There are few historical cases. I don't want to put more complicated here. Historical cases is somebody who had and then came here on the follow-up, and some of them are immunocompromised or specialized, like somebody who had a diabetes, somebody who has an asthma, somebody who has a chronic renal failure or a renal transplant. Then the situation is a little different. So that they have to be monitored a bit longer and bit more frequently. So this is basically about how it is done and how, as I said, how it's looked at. So there is another good article or good, I can share you the link for that, just to make sure that our house, whether sometimes what happens is when there is a possibility that anybody can test COVID positive at the moment. So we need to know whether we can make our house a COVID setting ready so that mentally and physically we are more comfortable. At least we are at the comfort of the home. So mentally, yes, we have given a good support. So there's a good set of, I can share you the link so you can see if you have most of us, I'm sure all of us here has a good house, so they have enough space to spare and they have a separate thing, so they can look at it and they can also see whether their house is, of course, public health will reassess on it. Faizi, would you like to add something on this, or do you want me to continue with another slide?
Happy for you to continue, Dr. Siraj.
Thank you. Faizi is one of our growing GP. So, and as Dr. Alika mentioned there before, she's a doctor of Dr. Faisal and Lenita, and of course they all are fine, wonderful people. And she's the one who's given me the few of the bits and pieces of information. All right. So what I'll do is I'll touch upon then the most important thing next is, we all talked about, I think Dr. Junaid also mentioned a bit of managing mental health online. Mental health, he did talk about something in pediatric age group. We all do pass through this stress and we do suffer this. The problem is probably there is a lack of, I wouldn't say inhibition. We don't really approach. We all go through this anxiety. We all go through this mild depression. We all are human. We tend to have our own days. Some days is good, some days is bad. But definitely when we need help, at least in the setup of Australia where we all are in now, there's a plenty of avenues you can explore. You can talk to your GP. There's a lot of online support where if you don't want to expose to anybody else, see, if you just look at that slide, Head to Health. This is a fantastic. It's a mental health mind spot. It's done by the Macquarie University. So that's also, they have a good online way to assess whether you have a mild anxiety or what kind of a support you need. And Beyond Blue list is endless. There's a big 2-page list, but I just picked up the main headlines too, so that I could just put in and just so that people do remember. Beyond Blue, MindSpot, Head Health is all there. Access it, utilize it. I'm sure all of you have your own GPs. So talk to your GP. He's the right person to guide you and take you to the next level. These all helpful things. Utilize it and and talk to any one of us as well. We are all here to guide you as well. Probably this is the last bit of my talk. It's 10 psychological tips. It just kind of I took this from the MindSpot. So in another way, it says some of them are overlapping, but I felt this do cover a certain bit. Probably we all are doing this at the moment. We all gone through it, bit of pieces. We are doing this, but sometime when you sit back and say, look, what do I really need to do? That link is missing. We don't do that. We never sit back and say we are anxious. We are tense. We don't know what to do. We are hurrying up. It's happened to me. It's happened to everyone. It's just normal. We are all human beings. Yeah, we make errors. We learn from error. Sometimes we don't learn from error. That's a fact. Yeah. So eventually you will learn. It's all learning game. So probably I'll just go through this one by one, and then we'll go from there. So get informed with the right information. This is the main thing, actually. We all are hardwired to react to possible threat to ourselves, our families, and our communities. These reactions usually keeps us safe from possible threats. But at times, what happens, our reactions are very excessive, unhelpful. And there's no, but so that it can cause it more stressful, more significant stress and worries. The main thing is you don't get the proper information. What happens is you go watch the TV where it's all sensitized and excessive information everywhere. You go to your WhatsApp group. There's a plenty of people sending you the messages. It's getting from everywhere. One person is saying, I have a treatment. One person is saying, I don't have a treatment. One person is saying, oh, is it really existing? You do surprised to see that. So one way to manage the reaction is access the right information. So where do you get the proper information? We have a good Department of Health website. Healthnsw.au is a really good website. Premier's daily meetings. She does cover quite a bit, half an hour, 1 hour. I don't know, sometimes I feel it's a bit bombarded, but definitely half an hour, 1 hour, she does give a proper things, what's going on, these many cases, where it's located, what's happening. Fantastic, all good. Or of course, we can all go for a WHO or a CDA sites, but I would rather prefer a local site. Next, what is next? Understand the history. Understand the history. Events like infectious disease often follow a very predictable path. We have seen as TB, we have seen SARS, we have seen Ebola. So we have seen all of this coming up. And I mean, we heard about the Spanish flu, the very famous 1918 Spanish flu. So when this COVID came, everybody's like, oh, look, there's 100 years back, we had a Spanish flu. Now this has come. So we heard about it. We have seen that. So that there is a normal cause. There is a pattern for all this infectious disease, any pandemic to come. Normally, there is a skepticism. Normally, people don't know what's happening. Is it really happening? Is not. Then what happens is people tend to give attentive. There's an attention. Then comes a panic where the stock market crashes, where the shelves becomes empty in the Woolworth and Coles. Yeah, this all happens. So we have seen that last year when initially it was hit. So there was a big panic. Then it's reality. All come to know that yes, something is happening. What do we do know? I mean, our experts are putting up effort, putting money in. They are building up something to protect us. And then comes this normalcy. So this is the pattern. This is how. So in a way, I would say at the moment we are sitting here, we have seen the reality part of it, and we are kind of a normalcy. We are hit back with the Delta strain again. So, but reminding ourselves, look, this has happened, so we are going to come across. We are trying to. We'll be somehow out from this. So that's unfortunately I do ask people saying that, oh, is it real? Isn't that somebody is making up the stories? Yeah, unfortunately, that's there. Still, people tend to be. So these all are wrong information they are getting. You can't blame them, but eventually that's what's happening. All right. Now, as I said, these slides could be just multiplication, but as I said, this I took from their MindSpot site. I felt really helpful for my patients as well. So that's the reason I'm sharing it here. Get organized. A good antidote for stress and worry is to get active and organized. We need to be active. We need to be organized. If you're worried about something, then do something. Try to do something. Try to plan. Try to make a list. Make a to-do list. I mean, try to get things done. So whenever you recognize that, yes, you are getting stressed, you are going through this path, what do I need to do to help you manage this situation? Ask yourself, sit down, ask yourself, what should I do? What do I need to do? Do I need help? Yes. If you need help, yes, talk to the people who can help you. Even our family members, they are also actively stressed and they also need getting this organized. Talk to them about your plans. If possible, share with them that same plan, help them to get organized. Same thing, not families, friends. I'm sure we all are doing that. Alhamdulillah, we are in such a close-knit community. We do help each other a lot, I've seen that everybody chips in their own effort. Everybody puts in their own effort. Plenty. I mean, mashallah, that's fantastic. And next is balance your thoughts. We have a positive and negative thoughts. Whenever we get stressed, our health and have a risk or infection, thought can be dark, brooding, and pessimistic. So, I mean, I'm sure now we don't be talking like this, but probably if it's 6 months or 1 year earlier, everybody would have added the same. How will I cope with it if I get sick? What I do? I mean, there's no vaccine, there's not. But now the situation is different. So and how do I deal with this? So these situations, remember, this is a very, very, I just want to stress on this. Yeah. Remember, our thoughts are not always true. Just try to remember that. Sometimes what we are thinking is not true. I mean, we're not necessary that we are 100% right. So that's the main thing. So that's a time when you need to help. We need help. So what do? Whenever you have any negative thoughts, recognize that yes, you are having a negative thought. Try to get a positive thought on that. This is my interesting slide. Yeah, shut down the noise. Stress is infectious and often unhelpful. So people tend to talk too much when they are worried. They talk all the rubbish. I mean, I wouldn't say rubbish, but yes, they make a lot of noise. So give yourself permission to switch off that noise. If you think that somebody is talking too much to you, ask him, excuse me, can I please leave? Yeah, that's the main thing. It's same thing with social media. If you think that, yes, you are getting bombarded with information, come off. Try to come off. And another thing is, you don't need to know the information every hour. There's no changes. It's not like a cricket score. Yeah, 500 becomes 600. No, today Kohli is hitting a double century. No, not necessarily. This is the cases. Each individual is affecting. So if it's 300 means it's tough. It's 300. It's not a triple century. Yeah. So I mean, just stick to 1 hour, 30 minutes. Yes, I've got enough information for the day. That's enough. Let me do other things. Enjoy some music, watch some movies, or if you have talent enough, then sing a song. Why not? The next is remember who you are. Yeah, probably just 4 more. I think 4 or 5. Yeah, another 2 minutes. I'll finish it up. Remember who you are. We all are very good, kind, and sensible human beings. We care for others. And I mean, we want to make our society good, our environment good, and that reflects in our values. We have a good ethics, values. We all stick to that, and we try to practice that on a day-to-day life. So when you have a stress, sometimes what happens is we struggle to make this. So remember yourself, think about who you are. I mean, what is your role of existence here? Try to remember that and try to be good. Yes, if you are, remember to be gentle, kind, and respectful to yourself and others, because everybody is stressed. What happens is if you try to help someone, it's not help for himself. It's an help for two. You feel that, yes, I've done something good. So feel good for yourself. That's a fantastic feeling. So you feel that, yes, I'm sure we all have had this feeling when you've been doing so many things and you feel that, yes, he's getting benefit out of it. Yeah, that's fantastic.
Speaking now.
Okay. Yeah, I think somebody was wanted to talk something. Is it? All right.
I'm going to mute all, and Siraj, you have to unmute again.
No. Okay. Yeah, am I unmute?
Yes.
Yeah. Okay. So where are we? Yeah, somebody was helping to be good, I guess. Yeah, keep healthy routines. And next couple of things is it's more of a repetitive thing. Keep healthy routines. We do have a good routine on a daily basis. Yeah, we wake up, we do things, and all the way to. So that kind of gives us an accomplishment. Yes, I've done this for the day. You feel good. But what happens when you're stressed? You mean your routines have changed. I mean, it's all, you can't go out and practice, or probably Saturday you used to go play. That's not happening. So you're a bit stressed. You're a bit depressed there. So yourself, whenever you follow the routine, you feel that, yes, I've done something for the day. Okay, I played well, or I mean, of course, we all do work Monday to Friday, but other days, these are kind of a small accomplishment you feel like. So that's missing. So what you need to do is, if that routine is not there, try to make your own groups. I'm sure we all have groups. I do share some of the groups. Yeah, they're all quite good singers and big chefs and all that. So, but only my concern is just be careful with the LGA limits. Yeah, there's a good restriction going on, curfews going on. So you don't want to end up paying a hefty fine. So just be on part that. Next is stay engaged. Another key strategy, keep good mental health being is this. Connect and engage with the people activities that are meaningful. There's no need of spending in WhatsApp and looking for things the whole day. No, try to do which is productive. 1 hour, yes, that's your time. Stick to that. I wish I could do that as well. I mean, I'm just talking, but sometimes I try to reflect myself. Yeah, I try to, probably I should stand in front of the mirror and say, oh, look, this is enough for the day. Try to spend more time with other things. So I think that that's about it. So do enjoyable things that are good for you, and the most important thing, keep looking forward. There is a light end of the tunnel. Definitely there is a light end of the tunnel. So this too shall pass. There is a big saying, yeah. So this definitely will pass. I mean, actually we had gone through that probably. I mean, I think this was more prepared for the first version of the COVID, but we have seen that we have hit back again. We had passed that, but that's a reality, yeah. So it has come back to us. Then definitely this will pass. So thank you very much. Thanks for listening me. Yeah, I've shown you this same slide again, and thank you.
Thank you, Dr. Siraj Hameed. Your presentation really gave us that insight into what happens when someone's got COVID, which a lot of us don't know and hopefully won't have to experience, inshallah, as well as the mental health burden and what it does to our psychology. And just as an example, when we manage patients isolating at home or at the health hotel, for example, the quarantine hotels, one of the common calls we get is people threatening to jump off the balcony. And the reason is because of the isolation. So you can imagine being locked into a hotel room. Sometimes you're not allowed any fresh air or to even go out. And for 14 days, that's very difficult for many people. So hopefully it's not something we have to experience.
Yeah.
All right. And what I'll do is if Dr. Siraj, I could get you to stop sharing.
Yeah, sure, I'll do that.
Okay.
A nice photo, by the way. Thank you
for sharing. Okay, so next we have Dr. Lenina Chanariel, who is a developmental and general pediatrician working at the Canterbury Hospital. She's involved in the education and training of junior doctors at the Canterbury, Concord and RPA hospitals through University of New South Wales and University of Sydney, in her post as the Deputy Director of Pre-Vocational Education and Training, and is also part of the General Clinical Training Committee. She is a curriculum committee member for the University of New South Wales Faculty of Medicine as well. She's a lecturer at University of New South Wales, and she is passionate about improving the health of all children. So Dr. Lenina will be part of our Q&A panel session, so please do welcome her. Along with her, we have Dr. Shahir Ahmed Kaidal, who is a nephrologist, a renal specialist, and with training experience in transplantation. He's a visiting consultant at Auburn and Goulburn Base Hospital. He's also a senior lecturer at the Australian National University and Notre Dame University. He's definitely a very familiar face for our community, and he's involved in various activities. I'm sure we all know him. So please welcome them, and they will be coordinating and part of the Q&A panel. Again, please feel free to ask any of your burning questions.
Assalamu alaikum. I think it's nearly 2 hours and 15 minutes for whoever is attending, and also for the speakers, maybe 10 minutes more. So you must all be tired, and we have already given the speakers that it'll be a 2-hour program. So I'm sorry that it's going a bit longer. If you have to go, if it's an absolute necessity, please leave. But we would prefer and we would love you to be here and answer questions. Actually, we were actively seeking for questions, and then our people have lots of questions actually. We have 29 questions. They came through the Google Forms, and at least until 10 minutes ago, I was noting on the chat box around 15 questions, so around 40 questions. So we would like to cover as much as we can, but I think we need to keep it time for everything. Just like Brother Siraj has mentioned rightly, there should be a limit for everything. So shall we go till 9, Dr. Parappil, or should we stop at or maybe 9:30? What do you think?
I think we kept 9, inshallah. If all
9,
speakers
yeah,
agree.
9 will be 45 minutes. That means we'll be running like a rapid fire session. So what I would like to see is we will be muting all, and pediatric questions, maybe a few of them will be answered by Lenina, but what I would like to see all the speakers is just watch for the questions. I'll be displaying that on the screen as well. And if you feel like you are the best person to answer, raise your hands. There is an option on the screen that there is raise hands, and then I can look at it and I can pick one of you. And also I wanted to make a note that Dr. Manzoor Abdullah is also here. He's a psychiatrist working in Penrith Hospital. He may also help us with if there are any psych related questions. And we also have a lot of other doctors in our community. Dr. Ansar, actually Dr. Amir Ali works in Westmead ICU. He's currently in active duty looking after Westmead patients. So I had a brief chat with him. So if there is any answers that related to those, I can answer as well, unless Amir is in the box. I must appreciate that we have 80% effectivity of this talk. After 2 hours, 80% of the attendees are still there attending the talk. So this talk is very effective for 80%. So we had crossed around 107 or 108. Now we are still 80. We still have questions. So may I ask you, all of you who were attending this talk, just stretch your body for a minute or two. Just stand up, stretch your body, just turn your face, and then come down, and then we'll start. How does that sound?
Good.
Please stretch your body. I'll be sharing the screen first for the questions, and then we see how we go. Are you able to see the screen?
Yeah, we can see screen. Yep.
Okay.
Yeah.
Because I can't see the speakers now. I have to see where the speakers are. Participants. Because I'm just sharing screen. I can't see the videos. That's okay. I don't need to see them. So I'll just see the screen. So I have to keep this participant screen big. So we want to answer this question. Is this COVID vaccine required to be taken every year like the flu vaccine, or one time is sufficient? I think Dr. Habib or Dr. Assoum can take the question. Habib is already on the mic, so please.
Sure, no problem. Look, we don't know at the moment that we need it, but most likely it would, because they are looking at some trials to see the boosters, and while it's not really came out as a routine, but it's all chances are that we may end up having it like flu every year, but we don't know at the moment for sure.
Thank you very much. The next question is, so we will try to make this as fast as possible so we can cover as many questions. So this is another question. After taking this vaccine after recommended by the GP, if there is a complication of fatality due to taking the vaccine, will the health cover the cost of any further treatment? I think so. That's a plain answer. The health, its healthcare is free in this country. Is there any compensation to the family if someone passes away, if it's got a severe disability? I don't know about this. Maybe Dr. Assoum or Habib can answer about that. The question is raised because the health and the government and now the community associations push everyone to consider vaccines those are not completely tested. So this is an accusation that this vaccine is not completely tested. It's a layman's term that is this vaccine fully tested? Is it safe? Why we are pushing? What are you going to do? Dr. Assoum, please. Assoum, sorry.
Yeah, not a problem. So the government has absorbed liability. So you are eligible for compensation. You are eligible for to seek legal action against the government if there is an event of vaccine injury or fatality. And that was released by Scott Morrison, mentioned by Scott Morrison a few months ago. I could put up a link to that in the chat.
Thank you very much. So there was another question saying that this vaccine is not completely tested. Do you want to answer that, or maybe Habib?
Yeah, sure. So the vaccine has been tested quite it has gone through all the processes of every other medication a vaccine will go through. So it's gone through trial phases 1 through to 3. For each vaccine, you've had over 45,000 participants in each trial, and we have comprehensive safety data for each of the vaccines leading well into the future and well into where we are now. And the vaccine monitoring is ongoing, and just like any drug, it's ongoing, and we always get we always have constant information coming in. But in terms of the safety signals and the safety data from the vaccine itself, it definitely is everything, pretty much everything we saw in the trials we are seeing now. So there is nothing new coming up in terms of side effects. And just to note, of all the vaccines ever created, there's not been a single case where a side effect has come up or occurred 6 months or 2 years or 3 years after the vaccine, and that's because peak immune reaction occurs 6 weeks after your or maximum reaction occurs 6 weeks and is captured 6 weeks after your immunization, and safety data goes up to 60 days after immunization. So technically speaking, we capture all data on side effects from vaccinations.
Thank you. As we proceed, I think we will be seeing a lot of repetitions, so you can ignore those repetitions. This is the third question. I think, yes. What are the ways to boost our immunity after we take both doses of vaccination? That's one question. Part of the next question is how long this will, I think it is just 6 months, the efficacy of the vaccine. Will there be a future mutants of COVID virus? Of course, we already have lots of mutants in the past. Is there any no vaccination for children below 12 years? How to protect them when the country open up? Well, I think I would like Dr. Lenina to answer that question, but let us wait for the first 3 questions answered. Maybe Dr. Assoum and Habib can do that.
Sure. I think in terms of let's start with the first question, the ways to boost the immunity after you take the vaccination. I think it's about any other general condition and remaining active, healthy. Also, Dr. Siraj mentions that how the mental health can affect physical health and whatnot. All of the social distancing we're talking about all the time, they continue, and that's what we need to continue to do so in remaining healthy with a healthy diet, exercise, everything else, looking after ourselves. And that's what we have to do. Just second question, I'll rush through, sorry. I think it's been covered. How long does it take to protect an individual? At the moment, we don't know for sure how long it is, but it seems to protect at the moment. And there are trials which are looking at how long does it take before the antibody level drops. So then you need a booster. So again, it comes back to the question. Having said that, most of the time, still vaccine is protecting even people who had that done, in the first bit. So that we will know as we go, and I think still time will tell us. Future mutant, I think you've already answered yes. The next question will go to Lenina.
Lenina, please answer this question. Is there any vaccination for kids below 12 years? How to protect them when the country open up, when majority of adults are vaccinated?
Yes, at the moment there is no vaccination providing to children under 12 years. The clinical trials are just on the way. There is almost 1.5 lakhs of children are in the clinical trial at the moment under Moderna, Pfizer and Johnson & Johnson. But these will take few months. For adults vaccination trials, they are doing only 2 months of follow-up for the side effects. But for children, young children, they need more time. So up to 4 to 6 months for their trial to complete. So we can hope the children under 12 may get the vaccine, may be available by the beginning of next year. But at the moment, as we know, they are not that vulnerable like adults from the morbidity or mortality from the COVID virus. So
thank you.
Yeah.
Thank you, Lenina. So the next question is just listen to, when we ask questions and find answers, just listen to what Dr. Aflah has mentioned right from the beginning. When you're asking the question, you ask the right person, and if the right person doesn't feel like he's the right person, he should refer this question to someone who knows it better. And if I don't know the answer, I have to say I don't know. That doesn't mean I don't know anything. It just means that we don't have an evidence for that, or maybe I didn't know about it. Maybe you should ask someone. Okay, so the next question is, will there be a booster doses to be taken every year? I think I will answer this. We don't know yet. It may be the case. And the next question was, why can't we come up with a foolproof vaccine for COVID-19? It's a very good question. And it's just, I think we tried to answer this, a lot of slides from intensive care unit. almost no one died after 2 doses of vaccine in the ICU, but 90% of people who are in the ICU or more are either fully unvaccinated or maybe 1 dose of vaccine. And those people who are dying after vaccination are either very severely ill or already immunosuppressed and things like that. It's just like asking why we don't have a perfect world. So why we don't come up with a foolproof vaccine? I think it will take time and a lot of ongoing study and research.
I just note that there are 3 additional vaccines under development at this point in time as well, trying to address future mutations of the virus.
Jazakallah. I think with every mutation there will be new, just like the flu vaccine is changing, flu vaccine is chasing the mutation. So if you're getting a flu vaccine this year, it is for the mutation that happened last year. So we are only 1 year behind with flu vaccine. Is that right, Habib? Or Assoum?
Yeah, sorry. Yes, I was mute. So it's exactly what you're saying. So it will continue to evolve. As the virus evolves, the strategy to address it is going to continue to evolve. So unfortunately, a lot of this question we're learning as we go along as well. Jazakallah khair. So next question we already answered by Lenina. The study is going on. The children's vaccine are not approved yet. The summary was that the kids are not at very high risk, but there is a big study going on, and soon it will come. Once we cover all the older people who are at high risk, then it will come, inshallah. So the next question is it possible by any chance of that even a dangerous mutation of coronavirus other than Delta would evolve? Yes, I think the answer is yes. Is there a chance that this will die away and becomes just like a normal flu virus? Yes, that is an answer as well. And I think that's a yes. It's for I don't think there's a specific answer you can give for that. Are there any medical conditions that are most vulnerable to COVID? Are there statistics around it? I think Dr. Ali has already mentioned in his slides that people with diabetes, hypertension, or kidney disease, immunosuppressed, older, very smoking with lung disease, any chronic health conditions, they're at high risk. That's already covered, so I wouldn't waste time on it. We can share the slides if you like. I think they already mentioned, this is a statistical projection question. Maybe Dr. Assoum, if you are around, you can answer this question, or anyone who is interested, you can raise your hand and answer this. At what point the system will break down? That's the basic question. This one is.
I don't have the answer to that one. Probably someone else.
Well, I was just seeing a note from someone saying in Penrith, if the Penrith district has got a daily case of 2,500, and then their ICU will be broken down. At the moment, I think that they are 1/4 of the ICU is full. In Westmead, around half of the ICU is full, and they actually pushed Blacktown Hospital to open their ICU with even the current numbers. So you can see that the systems can break down very easily. And those people, especially those who are not vaccinated or those who are severely sick, can actually face this risk of looking for a bed anywhere, and then there is no bed, you'll be stuck. And you can, if the things go out of control, you can see scenes that you have seen in India or in Italy or in Brazil.
So here,
yes.
Can I just add something, Shahid?
Yes, please. Yes.
Going on with private hospitals. To understand that few private hospitals have been backup for ICU beds and ward beds. So I don't think imminently a breakdown is going to happen here. A lot of backlog work is being ongoing. So I'm sure our system will be able to capably support what's going on right now.
Habib, please.
So there is a surge capacity, as Dr. Ali mentioned, and it can triple up to 3 times. But one thing I think we also have to look at, just not the number, the time it takes for a COVID patient to stay in ICU. The patient coming in and going out, it has to match. Or average ICU length of stay in general in Australia, what I've heard is around 3 to 5 days. For COVID patients is around 3 weeks. And that would mean that if you're constantly having patients going into ICU, at some stage they would be going in, but nowhere out. And I think that's what people are worried about, why you don't want them to go to hospital and go to ICU. So it's not just the magic number, it's also around the capacity of ICU to process the patient and either make them better or something like that, which is very hard to do.
I was just speaking with, sorry, what is that, Assoum?
Sorry, I was just going to say, so the critical element here is surge capacity can cope for a certain amount of time before it starts impacting the wider system, because you'll then have to be sacrificing essential services for other diseases as part of your surge capacity.
Okay, thank you. Amir was saying, Amir in ICU in Westmead was saying that many of those patients, they stay longer in the ICU itself. So as really clearly said, as things build up, people who get stuck there, they can't get out, then so no new people can go in. So that's a very terrible thing. Anyway, I think that someone wanted to make a fun of this question and answer. I think one of my cricket teammates, must be Asif, I'm guessing. He's asking this question: does the COVID vaccine affect cricket or sports performance? I think the answer is yes, no, isn't it? Unless you're affected by COVID, then that means you can probably stop playing cricket if it affects your lungs. So better get your vaccine, all teammates and everybody. So that's an anonymous question. If everyone gets vaccinated, will the consequences be reduced? And if yes, why isn't the government making it mandatory to make vaccine? I think Assoum may be the better person to answer this question in terms of public health. How is the COVID situation affecting us psychologically? Manzoor, if you are there, if you could please comment on the second question. Please unmute your mic. Are there any psychological changes observed in the past 1 to 2 years in terms of the pattern? And the third question is about is there a way to control cases in India right now, or is it a situation where everyone needs to be prepared to face COVID? And fourth question is, why does a person get COVID more than once? I think that's an infection related question. Probably could be answered by any one of us. So please raise your hands or unmute your mic, especially speakers. So the first question, please, Assoum.
Okay, so if everyone did get vaccinated, we'd definitely see massive reductions in consequences as put. So we'd see a reduction in cases, we'd see a reduction in over time as well, reduction in hospitalizations, and then we also have herd immunity and so on. And then the only difference is then when our borders open, how do we ensure that that kind of protection maintains and sustains within our community and our societies? So why isn't the government making it mandatory to vaccine immediately? That's a very political question, and the short answer is because everyone has the right to their own say to their own health at this point in time, and it's an opt-in. There have been mandates in the past, like for example, the TB vaccine was mandated in the past, and there have been a few mandates in the past, so it's not unusual to mandate, but I'm not sure if mandatory vaccines and vaccinations are possible these days, this day and age. And it could very well be because we do have limited availability of Pfizer and a few others.
Manzoor, Jazakallah, Dr. Assoum.
Yeah, thanks for inviting me. Yeah, the COVID situation can affect all of us psychologically, and those people who have been affected by the illness directly as well. However, having said that, we are still in the learning stages whether the COVID virus itself can cause problems, psychiatric issues. At this stage, we don't know about that. At this moment, the long-term studies are going on if there is any incidents or issues are being raised. So those studies are going on. However, we can see that there are lot of indirect issues which can cause psychological problems. One of them, a few of them are there. In this situation, mainly, as you know, that the quarantine issues is a lack of social issues. The other issues will having problems with employment, scheduled activities and things like that. A lot of stress, a lot of trauma. All these issues are increasing in mental health space. So we are seeing quite a lot of anxiety disorders, increase in anxiety disorders and depressive disorders. But we are yet to see any measure in terms of the suicidal episodes and things like that. However, we do see increase in mainly stress, anxiety, depression, and in those things. So what I would say as a recommendation is mainly to improve the resilience, the prevention strategies, to improve your mental health prevention strategies, mainly in primary prevention strategies. So that's basically about increasing the resilience skills. So the basic, what I would say in this community is going back to the basics of Quran and Sunnah. basically that would be the best way forward to increase that resilience skills, because there are a lot of things which do provide help and methodologies which we follow in our religion, which do help in improving the resilience skills. Dr. Siraj has already gone through quite a bit of self-help methods which we can use to improve the mental health prevention strategies while going through this crisis.
Thank you very much. And I think is there a way to control the cases in India right now, or is it a situation where everyone needs to be prepared to face COVID? Who wants to answer that? Dr. Ansar, do you want to answer that, or maybe someone else? Ali? If nobody's answering, I will just say that I think the vaccination, as we heard everywhere. Ansar, do you want to answer?
Yeah, sorry, I missed the question.
So the question is there a way to control the cases in India right now, or is it a situation where everyone needs to be prepared to face to get the COVID infection?
They are talking about Australia.
India.
Australia?
I think
they are improving the vaccination, and basically what we are trying to is vaccination is preventing the serious disease and death. The spread may continue. That is what my impression is.
Thank you very much. Why does a person get COVID more than once? Who wants to answer that?
Look, they can get COVID again because the natural immunity is not very long lasting, and also there are variants who come, one after other. So the problem is with COVID is it's not like some other conditions like chickenpox or so, where you have an infection and an immunity which can go on for a long time, and that's where it's recommended that you have a vaccine even if you have an infection, because you are not protected. And in fact, there have been lots of cases of reinfection, particularly in countries like India, where people had a second wave 6 months apart and so on, and they just actually drop mask, throw everything, and you just think you had a COVID, you're good now. Well, actually it's not. So, yeah.
Thank you. Lenina, can you please answer this question? What extra care should be taken for kids with asthma?
To be frank, there is nothing special to be done. It is like any virus induce your asthma exacerbation. So you have to keep up with your preventive medication, keep up with your asthma plan, and take the child to the hospital if they are short of breath. But one thing I can tell you, if you're using a nebulizer at home, better not to do that. Puffers are good because nebulizer will increase the spread in the household.
Thank you very much. I will answer this question. If you have had no problems with Covishield in India, your second dose is Covishield or AstraZeneca. You can have it. Every GP centers can do it. You don't have to have. I don't think you are charged. If is private patients, are they get charged for AstraZeneca vaccine? Dr. Siraj, are you there?
No, I don't think.
Dr. Siraj. Siraj, I think he's eating beef and parota.
Can I take it, the question?
Please.
Look, in Australia, it's completely free, absolutely free vaccine.
Thank you. So if you have no problems with the Covishield, which is AstraZeneca back in India first dose, there's no problem with the second dose. My daughter here had it, both doses. She was in Queensland. She has no problems. Every Indian in India is having AstraZeneca. Very, very rare problems. As the numbers I've already discussed already, so we don't have to go through that.
Sorry, I missed that question. Yeah, I went to get some water.
That's okay. That's okay. We'll come to the next question now. Hope your beef and parota is still waiting for you.
Mute. Shahid, you're on mute.
Sorry. So this question may be Lenina or Ansar or Habib. Anybody can answer. I would give a chance to Lenina now. Or breast milk and through pregnancy, do they transfer antibodies to the babies?
Yes. As like any other diseases, the breast milk is passing the antibodies to the baby, so it is protective. So no mother should stop their breastfeeding to their babies. Continue to do that. That is protective for the mother, for the baby. But passing the COVID through the breast milk, you don't need to worry about that. There is not much study to say that you are passing the corona through your breast milk. Is that answers the question?
I hope so. But what you're saying is that if the mother is affected with COVID and they can continue to breastfeed their unaffected child.
Yes, they can breastfeed the child. They have to just wear the face mask, continue to do the hand hygiene, and then after the breastfeeding, keep the child almost 2 meters away from the mother. So if they are COVID free after 10 days of positive test, they can continue the care as usual. So the mother should not worry about this. They should continue the baby's care, because the big problem we're going to get in future is psychosocial stressors, induced problems for these young babies. We don't know what future going to bring to these children.
The risk of transmission through the breast milk is not very well documented, very rarely, but the risk of transmission to the child is mainly through the secretions of the mother. So you need to have proper hand hygiene, mask, and all those precautions, what you need to do, and just continue the breastfeeding. That's what in short, as Lerina said.
Correct.
Is Imran around or is left already? Imran Kassam? I think he must have left. Are you there? So the question was about post-vaccination myocarditis and pericarditis. Can it come without any symptoms? I would say probably yes. But what they say is that after vaccination, for the 2 weeks after the vaccine, that's the risk where you can get the myocarditis and pericarditis. It comes with chest pain and shortness of breath. For the first 2 weeks after vaccine, try not to do heavy exercise. That's the main comment. And if you feel any symptoms, go for the test. But it's not a lethal side effect. It is a self-resolving side effect. Anyone wants to add on it? You can comment. Otherwise, we'll move on to the next question. That is for Manzoor, and if Manzoor is not there, maybe for Siraj. Lockdowns and boredom. Please provide some tips to maintain good mental and physical state.
Yeah, it's in terms of the improving, let's describe a little bit about what I talked earlier about resilience. So there are few strategies which can be used to improve the resilience skills. So making connections with the family and the friends, and have regular contacts with them. That's one way. Avoiding seeing crisis and insurmountable problems, because need to have some optimistic values and optimism around. That would help to have a positive outlook, and it also helped to have a hope. Accept that change is a part of living. So there is some ideas what we have in our mind. If that could be changed, sometimes that helps. Taking small actions towards your goal, even though there is a lot of resistance and there is a lot of problems which is happening at this moment. Even then, we are all stuck in lockdowns and things like that. But still, even if you take small steps towards our goals, that would be helpful. Looking for opportunities for self-discovery. So this would be the time. Many people are in lockdown. Many people would have long time in their in their possession at this moment in time. So this could be a good time to do a self-discovery. But some people don't have time. But those people need to look after yourself as well. Do have some breaks and nurture a positive about yourself. So there are this, and take care of yourself. And the general strategies, in regards to the mental health, what I would say is a balanced diet is very important. Having regular exercise, regular breaks from your desk. If you're working from home, that's very important. And take breaks once in a while. Do something which you enjoy. Activity scheduling. So your days should be scheduled part-wise according to the time what you do, and there should be occupational activities and also for time for yourself. Make sure that you're using some of your time for your hobbies, even though you are in lockdown. Even a small bit of time should give some time for your family and friends. Make sure you are doing self-care and things like that. So these all are the things. But also quite important is that I feel that spiritual growth is also quite helpful in improving resilience. So please be aware of that. It is many studies in Indonesia and things like that. What we have seen is that many of the religious methodology, what we do, like dhikr, Quran recitation, and things like that, has prevented depression and anxiety disorders. So please engage in those activities as well. All these will help with building resilience and improving the mental health skills as well.
Thank you very much. I think Siraj also want to say something, but in the interest of time, we will keep moving on. The side effects of the vaccine is already in the chat box. If you can go through it, so I'll skip this question. Thank you, Dr. Assoum, for doing that. Is it a good thing to do a blood work done post-vaccination? I don't think so, unless you have symptoms, which is the symptom that like headache, leg pain with muscle swelling, and any abdominal pain. If you get any symptoms apart from the pain where you get the vaccine or fevers for first day or two, you don't have to do any tests unless you are already having some problems that need to be looked at. Now this question is something very specific. I think this is a question about a mother who is breastfeeding or not, but if she gets swollen lymph nodes under the armpit, is it a side effect of Pfizer dose? Is this common? I don't think I've come across this. Habib, maybe you can talk about that. But I would say that if you have any swelling that is not going away, you should get it checked with your GP.
Yes, you're right. So I think in summary for Pfizer vaccine, may I just say, because this question keeps coming in, even the first question around the one side eye pain. So the muscle pain, joint pain, any pain is fine, is common. What is the problematic is if you have a swelling or if you have any change in sensation. So if you have a tingling, numbness, any neurological, any of those, this is when you should see or a swelling, exactly. So in general, if it is there, you should have that checked out. It may not be because of vaccine, but it needs to be checked.
May I welcome Dr. Amir Ali Kunduwail. He's an actively working now in ICU. He probably is wearing his PPE. Amir Ali, are you there? Can you give me like 2 or 3 minutes of what's happening in ICU and what are the struggles that you have coming in the future? What do you think about vaccination and effectivity? Amir Ali, can you?
Yeah, I can hear you. Can you hear me? Hello?
We can hear you.
Yes, thank you.
Hello. Its situation, I think it is getting worse, as you all know, as you are already aware. In ICU, it's getting busier. So, particularly the situation in Westmead, where I'm working, and Westmead ICU, it's half of the bed capacity is with COVID patients now. So currently I have around 18 patients in ICU, of which 6 patients are intubated on ventilator, and one of them is on an extracorporeal membrane circuit as well. And with regards to the vaccination status, I just went through all the patients' vaccination data, and only one patient has received 1 dose of vaccine, that's all, and all others are unvaccinated. And so we haven't seen any patients who's been fully vaccinated in ICU yet here, and it is unlikely, I think. So the best thing is to prevent coming into ICU, or even for that matter, even preventing hospital admission. I think vaccines are very effective, and we should be, prevention should be the best thing, and to try to avoid ICU and hospital care. Once you get into the ICU, we don't know the all the data are showing up to 40% of mortality, especially if you are getting to severe ARDS and all. And then apart from that, once you are in ICU, it takes few weeks. It's not like you will be in ICU, will be out of ICU in 3-4 days. These patients are staying in ICU 3 weeks, 4 weeks, even more than that. I've seen patients being stuck in hospital for months with this sort of illness. So, and then after that, they are having post ICU, they are very weak. It takes many months, or sometimes they won't be back to their previous state of muscle strength and all, and a lot of other psychological issues as well with these patients.
Jazakallah, thank you very much. I think you scared us enough to get vaccinated, and we can trust you. And you are working in the intensive care unit. You're actually on duty, and you are telling your actual experience. So it's scared us enough to get our vaccination ASAP. Is that clear for everyone? Yes, I think the mics are off, so you can't talk. If Amir, if you want to stay back a little bit and raise your hands for any other questions, please do so. But if you have to go back, thank you very much.
Yes, in fact, I just finished my shift, so it should be fine now. Yeah.
Please stay back then and mute your mic. Thank you.
Yeah, sure. Thanks.
Now there are questions about this. I think this is already discussed. Are there any possibilities of more variants? Of course there are. The virus doesn't have any brain to read what we are doing or fight against. It keeps mutating, and new variants will come. The variants could be deadly, or it could be just like a normal flu virus. We don't know. It's only every year. Actually, mutation is happening every few months now, isn't it? In 18 months we have like 5 or 6 different variants. So every 2-3 months we hear about new mutations. So I'll keep moving with the questions.
And just to note, those mutations are just the main mutation. You've got many sub-mutations after that too.
Absolutely. It's just like a family. Like if I have son, all my sons look half like me, then they have their own different look. And then they have children, they have some looks of me, and then they also have a different look. That's how the viruses also, they mutate, they change. How effective? I think we've already talked about the effectivity of the vaccine, and with new mutation the effectivity can go down. That's why we need to have new vaccinations with the new mutant antigens expressed on the vaccine. So with the booster next year may be slightly different. It may protect the Delta completely based on the approvals and studies. I'll keep moving on. We got 8 minutes. If we want to stay back a little bit, we can, but we'll try to finish as many questions in next 8 minutes. So this is a question. What is the difference between infection-related immunity versus vaccine-related immunity? You heard that already. You don't want to have an infection and going to suffer. If we don't know who is going to suffer. We know that 5% of patients who have the bad infection, they end up in ICU, and 40%, it should be half of them, 50%, now it's 40% die. I don't think you want to go through that. But what we know is who got natural infection, they are slightly protected, but the immunity gets waned. It will go away. You still need to have a booster or a vaccine dose. Is that right, Dr. Assoum, Habib?
Yes.
I think, yeah, thank you.
Yes. No,
now this is a funny question. I think this sort of questions always popped up last year, including using anti-disinfectants injecting to the veins. The Siraj probably put this question as a funny thing, but what he wanted to highlight is there anything that you can to prevent COVID? I don't think so. There are very healthy young people got COVID, whether drinking lemon juice or speaking out loud or crying out loud or running around being fit. Of course, healthy lifestyle helps you to get better quickly, but we don't know who is going to get the bad infection, because what we know is there are young people who have had very bad outcome. Is Lenina or Assoum want to say something? Please do so, otherwise.
Revived vitamin C generally will improve your immunity or your immune status. It is good for you. So maybe he's thinking in that point of view, vitamin C containing food are good for you.
But the studies have not proved that giving vitamin C has changed anything in the outcome of COVID. Is that true?
Not for COVID, just generally for your immunity. Not for COVID.
Okay.
So the studies have shown vitamin D, patients who had high blood serum vitamin D had better outcomes than patients who had low vitamin D.
Okay.
So that's just something to consider.
All right. This next question is probably related to why they changed the duration earlier. Like in UK, they said after the first dose you can have the second dose after 4 months. Initially they said 8 weeks, then they said 3 months, then the 4 months, and then everybody got vaccinated. Now they are saying you can have it in 8 weeks. Why is that happening? Maybe Ansar want to answer that?
Yeah, the general principle with any vaccination is between 2 doses there should be a minimum gap of at least the usual was 4 weeks, but with Pfizer they kept us 3 weeks, and it can be between 1 to 3 months. So, and depends on the health policy, the changes. If they wanted to vaccinate a lot of people in a short time, they keep it in a 3 weeks and they get 2 doses of the health workers covered. The a lot of AstraZeneca available and they wanted to do double dose and get more people protected, they kept the AstraZeneca gap short. If there is less availability in India, they kept for 3 months gap. So that is the general policy is if you have a gap of 1 to 3 months between 2 doses, it is okay. And then some of these choices of 3 weeks, 4 weeks, 8 weeks, 3 months, it depends on the public health status of the country and the place, and they keep changing that post. That is the idea behind it.
Thank you, Ansar. The next question is AstraZeneca vaccine name is changed recently. Does it mean only name is changed or composition updated too? I'm not sure of this answer. Maybe someone can say.
It's just the name to align with the international names for AstraZeneca. The contents haven't changed.
It's probably like the Chinese people have their English names to align with the English people, so people can pronounce that easily or something similar. They are just for everyone knows, call it the same, because in India it's Covishield, in AstraZeneca, or in UK it's Oxford vaccine, in Australia is AstraZeneca.
It's most likely for the vaccine passports that are coming out, because you'll need approval to be able to travel, so they need to make sure they've got the same name across the board.
So this question probably maybe Lenina can answer, or Habib, or anybody else if you're interested. In Australia, can parents accompany children if they are tested positive? I think it may be that, it depends on the age of the child. If they need support by the parent, they still have to protect themselves. It's just like in the flights. You for the oxygen, first protect you and then protect the next person. If you're not safe, you can't protect the other person. So anyone wants to add to it, please. Otherwise, we'll move on to the next question.
Usually it's the family unit who gets infected. So generally the children are actually getting infected from adults. And then when they get admitted, adults are getting admitted, including in our hospital. The principle is we're trying to keep children and parents together rather than separating them. So the children goes to children's hospital and the parents stay in Nepean. We don't try to do that, so they all stay together. But they can accompany, and I think like in any other healthcare worker, if there is a child who's positive, parent isn't, they wear all the protective, measures and so on, and still look after, because they are the best people to look after them.
Thank you. So next question is, what is the chance of kids getting infection if the parent is positive? I think it's very, very high, but the problem, the good thing is that kids don't get symptomatic infection. They just don't, even most of them, they don't feel anything. Very rarely they get some runny nose or fever, and very rarely they get very bad infections. So Lenina, want to say something, please?
Yes. Mostly the problem we are finding at the moment is parents are admitted in hospital or ICU, and the kids have no one to accompany or stay with them in the hospital. So the Westmead Hospital is having the home in the hospital, as Junaid said. And also we do some babies admitted in Canterbury Hospital where parents were admitted in other hospitals. But now the kids hospitals are doing that service.
Shahir, we can wind up 9 o'clock now.
Lenina, you want to answer this?
Shahir,
Brother Ali, what I was thinking is that those people who want to leave, they can leave. We can still answer the questions.
I think most of the speakers have left out.
At the moment, 80% is not including the children.
We have
16 years.
Okay, thank you. Alika, I think because there are still people there, we'll ask the people to leave. If officially we can close it at 9, but we still have like 15 questions to be covered, because they take the pain of asking the questions. We'll try to answer.
Now what we can do, Shahir, is like any other association, we can email them the answers personally after the spurt. That's what we did last time with the Habib team. So
okay,
we have to have a limit for everything.
No problems. Okay.
So we stop it here.
And happy to I think answer, as you know, we've got a couple of other colleagues as well, but as Dr. Ali says, it's probably appropriate.
No worries. Jazakallah khair. I think that's a good thinking. I was thinking like that as well initially, because there are still a lot of people there. I just thought we'll continue. But
I've
okay.
also answered few in the chat box already, Shahir, and I think
absolutely.
Some of those over there.
Absolutely. I think what we have to do as organizers, we have already collated all the questions until the session, the Q&A started, and after that we have to copy paste it, and we'll try and put Q&A session and put answers there.
And if anyone if anyone has any genuine question, ask us directly rather than Googling and finding or going into any conspiracy link.
Okay, now that now that we are before I conclude this, I would just want to say that I think Dr. Faisal Kakat is going to who's going to the last session speech. Thanks.
It's me.
Alika. Okay, just before that, I just want to ask. Sorry, brothers, we couldn't answer all of your questions, but we will definitely, inshallah, it will be shared through WhatsApp chats. So make sure you have contacted the person from where you got this invitation, so that you'll be able to get the answers. If anyone has got any burning questions, they can raise their hands or unmute the mic. I will give you a chance for only one question. If anyone has, I will wait for 10 seconds. If you don't have any burning questions, I'm sure our expert panel has answered almost all of your questions. But if there is any burning question, you can ask now. Otherwise, Jazakallah khair for active listening. And yes, we are still 50% effective. Jazakallah khair. It's 50 people are still there. Alika, please take over.
Faisi, can I take it over? Take over? Okay.
Yes.
Okay. Okay. All right. Inshallah. Jazakallah khair to each and everyone here. I thank Shukr Allah for having a very wonderful session we can conduct for this community. And I think it's very useful, as Shahid said, even though we had 108 till 3 hours of completed, we are almost 50% effectiveness. That's very good. Jazakallah khair to all of you. Let me thank you, Abibai, Assoum, and Lanina, and Manzoor, and Ansar, and my other panel speakers,
Junaid,
Siraj, Dr. Imran, Junaid, and Shahir, for you for conducting a very good Q&A session. Let me also thank Faisal and our anchor Faisi, and our AMIA community, and other community who took part in, for example, the Gujarat, the Habib IDCO, and the Aligarh, and Alma, and TAMS, all with people. So let me thank everybody from my bottom of my heart on my community behalf. And it was a very good session, inshallah. We may keep another session if needed. And I'll be coming to you again for your help to have another session if needed, inshallah. I thank once again, Habib and Assoum, we've been here. I know we dragged a lot, even though I promised you 2 hours, it went to 3 hours. My apologies for that, but Jazakallah khair. May Allah reward you all for the time and effort for you and the family you have taken and shared the knowledge that you had to my community. For that, I'm sure many of the misconceptions what we had has been cleared. As we said, we had many more questions on the backlog. Inshallah, we'll try to answer it as much as possible. So as Said said, we'll keep in touch with you and then try to answer this question slowly, inshallah. Jazakallah khair, and we close today. Assalamu alaikum wa rahmatullahi wa barakatuh.
Thank you. Thank you for the opportunity.
Thank you. Jazakallah khair. Muhammad, Assoum, thank you very much. Jazakallah khair. Larina, everybody.
Thank you.
Okay, Manzoor, Ansar, everyone. Jazakallah khair. Sheikh, thank you very much. Off it up. Hameed, Jazakallah khair for it. Okay, man.